Good morning to those of you who are joining us this morning. Welcome to the Joint Standing Committee on Health and Human Services. We're glad you were able to join us. We'll be hearing 3 bills this morning and 6 this afternoon. We'll go in the order starting with LD 529, since that's the only request we've gotten so far, and then go to 510 and 601 in that order. You can watch as well as listen if you go to legislature.maine.gov, look up under Health and Human Services for our very own YouTube channel. Everything is recorded, so if you can't stay for the session today that you want to hear about, you can go back and catch the recorded episodes that preceded. We continue to discover little glitches in our electronic capabilities, so bear with us, be patient, we'll get there. My cell phone is off, so I saved myself $5 that way. And we're not going to be using the chat except for things to move the committee work along, no content. Make sure that you're properly identified when you're by your name underneath your picture when you're testifying. And then if you're the sponsor, you can stick around or go back out to the panelists or the attendees list and hang out there until we're done. We do ask those who are not sponsors to limit their comments to 3 minutes. That's about a page and a half. And we have some serious enforcers available should we need them. So why don't we do introductions? And I'll start with Representative Zager.
Thank you, Mr. Chair. Good morning, everyone, and happy St. Patrick's Day, especially to Representative Craven. My name is Sam Zager. I am honored to represent District 41 in Portland.
Representative Lemlin.
Thank you, Senator. Good morning, everyone. My name is Michael Lemlin. I represent District 88, which is Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good morning. My name is Holly Stover, and I represent House District 89, including the towns of Boothbay, Boothbay Harbor, South Port Edgecombe, West Port Island, and part of South Bristol.
Representative Perry.
Good morning. I'm Representative Perry, representing House District 140, which includes Indian Township, Baileyville, Barron, Calais, Charlotte, Robinson, Perry, Pembroke, and Pleasant Point.
And Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Kenduskeag.
And Representative Connor.
Thank you, Mr. Chair. Good morning, everyone. I love Representative Craven's shirt. My name is John Connor. I represent House District 58, which is part of Lewiston.
Representative Craven.
Thank you, Mr. Chair. Good morning. Thanks for the greetings, everybody. My name is Margaret Craven, and I represent House District 59, which is part of Lewiston.
And Representative Grandmother Colleen Madigan.
Hi, my name's Colleen Murade Madigan. Happy St. Patrick's Day, everyone. And yes, I'm a grandma as of 4:10 this morning.
Congratulations.
And I represent House District 110, part of Waterville, part of Oakland.
Representative Javner.
Good morning. I'm Kathy Javner, and I represent the amazing super rural communities of Burlington, Carroll, Chester, Drew, Kingman, Lakeville, Lee, Lowell, Mattawamkeag, Prentice, Whitney, Springfield, Twombly, Webster, Wynn, Alexandria, Codyville, Cooper, Crawford, Danforth, Dayblock, Dennisville, Forest City, Grand Lake Stream, Greenlaw, Chopping, Cassuth, Lambert Lake, Meadowbanks, Princeton, Talmadge, Topsfield, Vanceboro, Waite, Cat Hants, Edmonds Township, and Marion Township.
Good for you. Senator Moore.
Thank you, Representative Javner. She gave me time to run across over to the State House. So I'm at the State House now. Thank you, Kevin. Good morning. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County. And I'm not going to list the towns, I promise you.
Representative Meyer.
Good morning. I am Representative Michelle Meyer, serving Southern Maine's House District 2, which is parts of Kittery and South Berwick and all of Elliott.
And I'm Ned Claxton. I'm proud to serve the folks in Senate District 20, which is Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. And as I mentioned earlier, there are occasional technical glitches. There are also memory glitches. And I misspoke this morning because we had previously promised that LD 510 could be heard first. So I apologize to Representative McCray for missing that, and to Senator Carney for implying that she could go first. That was my mistake. I'd forgotten we'd agreed that. So if we can get the folks from 510 into the room, that'd be great. Is she here? I don't see her on the list. There she is. There she is. Welcome, Representative. Sorry to put a glitch in your morning.
Only a mild heart attack. Thank you. I have a public hearing in another committee, so I very much appreciate you shifting that around. Shall I start?
Please.
Thank you. Senator Claxton.
Can you wait just a sec? I forgot to have the staff introduce themselves. So I saw Erin's picture here earlier. She might still be around. There she is.
I'm here. Sorry, Representative McCray. My name is Erin Dooling. I don't represent anybody. I'm from the Office of Policy and Legal Analysis, and we don't take positions or advocate for any legislation.
Feels like Friday afternoon. Our clerk is Ms. Withy.
Good morning. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
I don't see Anna here, and I don't see Luke. So we can proceed now to your testimony, Representative McCray.
Thank you. Senator Claxton, Representative Meyer, esteemed members of the Health and Human Services Committee, I'm Jay McCray, representing House District 51, Harpswell, West Bath, and Northeast Brunswick. Thank you for allowing me to be here today to present LD 510, a resolve to reduce stigma regarding substance use disorder by requiring the use of respectful language in the Maine Care Benefits Manual and other Department of Health and Human Services publications, which maybe I should get an award for longest title. The issue is one that has been top of mind for me as a former social worker, clinical counselor. To support others in their goal to lead the lives they've intended, we need to afford to others the same dignity and respect we all want and deserve. Removing the use of stigmatizing language is an important part of this effort. Some of you will remember that one of the outcomes of the work of the opioid task force in the 128th legislature was a bill that passed in this committee. The result was the removal of stigmatizing language in statute whenever possible. However, it was brought to my attention by professionals currently in the field that we have more work to do. They noticed that even though we've made strides in reducing stigmatizing language around substance use disorder, our publications are lagging behind. The proposal before you is to direct the Department of Health and Human Services to review the Maine Care Benefits Manual in particular, and any other relevant publications to ensure that we are removing stigmatizing language and switching to empowering language. This means replacing the phrase substance abuse with substance use disorder, and to update our publications to include respectful person-first language, as in person with substance use disorder. Person-first language avoids labeling a person as a disorder. It recognizes the individual first and stresses that an individual may be someone who has a disorder diagnosis, but who is separate from that label. I know from my work and from my life that language does matter. And I ask that you support this resolve to continue our progress toward the use of non-stigmatizing language. Thanks for your attention, and I'd be happy to try to answer any of your questions.
Are there any questions for Representative McCray? Thank you for bringing this in front of us. We'll keep chipping away at these things.
Thank you.
And we're also going to be hearing from Mallory Shaughnessy, speaking for. If you want to unmute yourself and join us, we'd be glad to hear from you, Mallory.
Yes, sorry, it was not responding to me. Hi, Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. I am Mallory Shaughnessy, Executive Director of the Alliance for Addiction and Mental Health Services of Maine. The Alliance is the statewide association representing the majority of Maine's safety net community-based mental health and substance use treatment providers. On behalf of the Alliance, I am here today to speak in support of LD 510, and I'm not going to read the whole resolved name again. Stigma is defined in the dictionary as, quote, a mark of disgrace associated with a particular circumstance, quality, or person. Social stigma is the disapproval of or discrimination against a person based on perceivable social characteristics that serve to distinguish them from other members of a society. Social stigmas are commonly related to culture, gender, race, age, intelligence, and health. We know there is still stigma within the healthcare field regarding people facing the challenges of substance use disorder, and having this language in the Maine Care Manual that is referenced all the time reinforces this stigma. Words matter and impact attitudes. According to the National Institutes of Health, stigma is a discrimination against an identified group of people, a place, or a nation. Stigma about people with SUD might include inaccurate or unfounded thoughts like they are dangerous, incapable of managing treatment, or at fault for their condition. Stigma stems from the antiquated and inaccurate beliefs that addiction is a moral failing instead of what we know it to be, a chronic treatable disease from which patients can recover and continue to lead healthy lives. Throughout the manual, the terms substance use disorder, substance abuser, substance abuse treatment, etc. occur. The only other places in the manual that the term abuse is referenced is in history of trauma and abuse, sexual abuse or sexual exploitation, abuse, neglect, or exploitation. The only time it's not in reference to someone's substance use is when it's in relation to abuse and neglect of others. Someone struggling with addiction and working to change their lives for the better shouldn't be subjected to these same terms. There's some lists in here of how stigma affects people with substance use disorder. There's a number of studies that I included links to in my testimony. Feeling stigmatized can reduce the willingness of an individual to even seek treatment. Stigmatizing views of people with SUD are common. Stereotyping can lead others to feel pity, fear, anger, and social distance themselves, not in COVID times, from people with SUD. And stigmatizing language really negatively influences healthcare provider perceptions, which can impact the care and the physical care and the primary care that they receive. Because clinicians are typically the first point of contact for a person with an SUD, health professionals should be taking all steps necessary to reduce the potential for stigma and negative bias that they encounter. So this change is an important step on the path to reducing these barriers for care for those with substance use disorder. And we thank you for your attention to this matter. We said a big thank you to Representative McCrate for bringing this issue forward. We are asking for your support of LD 510. And I'd be happy to answer any questions if you have any.
Thank you, Ms. Shaughnessy. Are there any questions to the committee of Ms. Shaughnessy? I don't see any. Thank you very much again. So now we'll go to Sarah Calder, if you'd like to join us. Welcome.
Good morning, everyone. Good morning, Senator Claxton, Representative Meyer, and members of the committee. I'm Sarah Calder. I'm the Director of Government Affairs at Maine Health, and I'm here to testify in support of LD 510. Maine Health, which includes Maine Behavioral Health Care, is committed to creating a seamless system of behavioral health care across Maine, and that includes coordinating hospital psychiatric care with community-based treatment services and better access to behavioral health care through integration with primary care services. Over the last 5 years, Maine Health has invested in a multifaceted model to address substance use, or the substance use epidemic facing our state. And I'm happy to report that today we have over 1,100 patients in treatment in every county that we serve. Substance use disorder is a disease of isolation. Stigma adds to the challenges people face in seeking treatment. The language that we use in describing substance use disorder must reflect respect, dignity, and compassion for those who face this challenging disease. As such, we strive to use language that is inclusive, welcoming, recovery-oriented, and free of the judgment and shaming that is all too often a reality for those with mental health or substance use disorders. When we use terms like substance abuse, we are complicit in labeling people suffering from an illness as abusers. This makes them feel more shame, less connected, and less willing to reach out for help. And so I'd like to thank this committee for its support of legislation in the 128th legislature that removed stigmatizing language from state statute. And this bill, as you've heard, will make the same updates to the main care benefits manual. So by supporting the legislation before you today, you have the ability to promote hope and reduce stigma. If we intend to create a community that encourages people to seek support and treatment, then we first need to talk about how we use inclusive and welcoming language. And thank you, and I'd be happy to answer any questions that you may have.
Are there any questions for Ms. Calder? I don't see any. Thank you for being here.
Thank you.
Next, we'll hear from Molly Bogart, speaking neither for nor against. Welcome, Molly.
Good morning, Senator Claxton, Representative Meyer, Representative McCreight, and the HHS committee. I'm Molly Bogart, Director of Government Relations for DHHS, and as you noted, we're not taking a position on the bill. I wanted to draw your attention to a letter from Director Probert in Maine Care that talks about how we are implementing LD 1871 from the 128th. We completely agree with using respectful and person-first language and have been working to update rules as they open for other changes. As you know, rulemaking is a long and capacity-heavy process. And so we have been making these changes as rules are opened up for other reasons to make sure that we are both complying with the law and with our shared belief that we should be using this affirmative language, but not opening rules specifically to do that because of the time and capacity that it would take. And so if we were asked to prioritize these changes and do all of the rule changes immediately, then that would create some challenges with other rulemaking and potential delays there, as well as a fiscal impact based on additional capacity that would be needed to process the rulemaking. But we share absolutely the goal of the legislation and are working to implement that as we speak.
Thank you. Are there any questions for Ms. Bogart? At the current pace and with the current resources, Ms. Bogart, do you have some guesstimate as to how long it would take to accomplish what the old bill and this bill require?
I'd have to talk to Maine Care about how far along we are and how many more sections we have to update.
Okay. Yeah, I'd be curious to know, but I appreciate the work. Thank you. Representative Craven?
Thank you, Mr. Chair. Molly, is there any kind of an amendment that could be added to the bill that would allow for the process to go forward and not be so cumbersome for you?
I mean, I think so we're already required to make these updates from LD 1871. And so we are currently doing that at the pace that it allows. If there is an amendment that someone wants to propose, I'm happy to work on it, but anything that would require us to prioritize this over rules that are already in the schedule would disrupt that schedule, so would create that disruption.
Okay. So I don't see anybody else who's interested in testifying neither for nor against, positive or negative. Is that correct, Ms. Withy? So that would conclude the public hearing portion of this bill, LD 510. And are there any requests of Ms. Dooling before we proceed to the next bill? Yes, Representative Zager.
Thank you, Mr. Chair. I guess I'd be interested if there's a differential in terms of money or time or ease for the department when making changes in electronic format versus print, any print publications.
I could answer that now if that's helpful.
Sure.
So we are required to follow the Administrative Procedures Act for any changes to our rules. And so it would all have to be done through the rulemaking process. We couldn't, for example, update electronic versions of rules, but not any printed materials, unfortunately.
And just if the chair would permit
Please.
follow, is that something that we could, change or amend in this act, in this bill, so that would make it so that you would not have to comply with the Administrative Changes Act in that way?
I would defer to OPLA probably on your authority to do that. I think you certainly would have the authority to do it. The Administrative Procedures Act, creates a structure around these that involves stakeholder engagement and stuff. And so we'd have to have a bigger conversation about whether that would make sense here. But as far as your authority, I assume you could, but would want confirmation.
Thank you. I guess for the work session, that would be I'd be interested in more information about that from OPLA. Thank you.
Are there any other questions that people would like to ask? I'd like to understand the difference between LD 1871 and this one. I'm always looking for an opportunity to not add to the statutes. It's a personal agenda.
I just want to note that that bill is posted to your electronic LD file, so you can reference that, but we can also talk about it at the work session.
Yeah, it's already there. The work's already done. Thank you. Yes, Representative Javner.
Just a logistical issue question. How big of a document is the main care benefits manual that this bill specifically is asking for it to be changed?
That includes every section of main care policy. And so as a whole, it's pretty large, although, as I said, we've been making those changes. So what remains to be changed, I have to get a sort of catalog from main care, but it wouldn't be the whole manual.
Okay, perfect. If we could have that for the work session, that'd be great. What percentage of it is already changed and what the percentage is left?
Sure.
Thank you.
Okay, any other questions? So at this point, we'll thank Representative McCreight for bringing that forward, and we'll proceed to the next bill, which is LD 529. And I understand Senator Carney is here, and I've already apologized to her for via text for promising first and then not being able to deliver. So the floor is yours, Senator Carney.
Thank you very much. And actually, I was very interested and learned something from the previous hearing. So I'm very glad to be second in this instance. Thank you. Good morning, Senator Claxton, Representative Meyer, and esteemed members of the Health and Human Services Committee. I'm Ann Carney, representing Senate District 29, which is South Portland, Cape Elizabeth, and some of Scarborough. I'm pleased to introduce LD 529 today, an act to restore the Maine Center for Disease Control and Prevention Cystic Fibrosis Prevention Assistance Program. Cystic fibrosis is a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time. In the lungs, the mucus clogs the airways and traps germs, like bacteria, which leads to infections, inflammation, respiratory failure, and other complications. In the pancreas, the buildup of mucus prevents the release of digestive enzymes that help the body absorb food and key nutrients, resulting in malnutrition and poor growth. In the liver, the thick mucus can block the bile duct, causing liver disease. And men with CF can experience difficulty having children. An information sheet is attached to this testimony, and you can learn more about cystic fibrosis at the Cystic Fibrosis Foundation website, and that live link is in my testimony as well. Advances in medical care have greatly improved the quality of life and added decades to the lives of people with cystic fibrosis. Care includes medications for symptom relief and treatment of the genetic mutation. It includes airway clearance techniques, pulmonary rehabilitation, and surgery. You will hear from Mainers with CF and their families who can help you understand how LD 529 will support their medical care. I'm so grateful that a constituent of mine, Patty Morris, brought this issue to my attention. Patty's adult daughter, Allie, has CF, and finding ways to afford to cover the costs associated with CF have been challenging, even with her private health insurance, her needs-based disease-specific grants, and drug and manufacturer copay assistance. This bill will help Allie and the 260 Mainers with CF have healthy childhoods, become parents, pursue careers, and live longer, fulfilling lives. The Cystic Fibrosis Prevention Assistance Program, created by LD 529, reestablishes a pilot program that provides up to $3,000 a year to help Mainers with CF and their families afford necessary care that is not covered by insurance. Effective CF management can be extremely costly, even for those with insurance coverage. A study of the barriers to affording care, which is also linked in my testimony, and underuse of medication among those with CF, showed that 1 in 4 people with CF had unmet prescription drug need in 2019, and also that the likelihood of having unmet needs is much higher among adults. Those insured through Medicare were particularly likely to have unmet prescription drug need due to the cost-sharing aspects of Medicare and because some of those individuals may be sicker. Passage of LD 529 will ensure that Mainers with CF and their families can afford the prescription medications and other care they need to manage this chronic disease and help those with cystic fibrosis to live longer and more fulfilling lives. Thank you very much for listening today, and I'm happy to answer any questions.
Are there any questions for Senator Carney? Yes, Representative Craven.
Thank you, Mr. Chair. I just wonder why insurance companies aren't required to pay for the medications that people need, and is MaineCare included in the grouping that aren't providing the medications that are needed?
Thank you for the question, Representative Craven. I also wanted to just admire your green. I am also wearing green today for St. Patrick's Day. Nice. And it's a little more complicated. I think the issues are multifold. One is deductibles for insurance policies. High deductibles in particular mean that people with CF who have who know that every year they're going to have very significant healthcare expenses are impacted by those high deductibles in a way that people who may not use healthcare very much during the course of a year aren't impacted. And the other thing is that there are kind of a wide range of expenses that aren't typically covered by insurance policies, like transportation to clinic visits and some medications and some specialty food items that also are not covered. And so it's a little bit, because of the nature of the disease, it's a little outside of the ordinary parameters of insurance.
Representative Javner, you had a question?
Yes, thank you very much, Chair. Senator Carney, in your testimony, you cite $3,000 per year. Is this $3,000 per family per year? That's not the whole program, right?
The program would be, and this is what had been in existence for several years prior to 2019, but the program would be up to $3,000 for any individual receiving treatment for cystic fibrosis. I mean, some families actually might have more than one child that has cystic fibrosis, but that's what the pilot covered, and that's what this bill intends to reinstate.
Thank you.
Senator Moore, you had a question.
Thank you, Senator Claxton. I was jumping back on that reestablishes. I was very curious about when the pilot occurred, when the pilot went on before, what was the results? How long did it last? What was the cost? I don't know if you have that, Senator Carney, or not.
I don't have a lot of detailed information about that. The program lasted for several years. It ended, I believe, in October of 2019. I also think that there is some testimony from the today, but they did provide that information.
I'll go back and look. Yeah.
Yeah, thank
And so now we'll move to testimony from those in favor. I apologize if I get the last name right or wrong, but Ms. Maradian, are you ready to speak and join us?
Years, I worked as a registered nurse before needing to stop due to my health. At that point, I went on Social Security disability, and now my income is solely my Social Security, and my health insurance is through Medicare. When I first had Medicare, I also had 2 organizations that I received copay assistance from. So frequently it is the cost of the copays that are so high that we need help with that. They no longer are able to help us because they lost the funding that they had for cystic fibrosis patients. I now get assistance through the HealthWell Foundation. But even with that, the number of dollars that we get per grant per year is fairly limited for what our costs for medications can be. It did happen at one point that although I had HealthWell, I did have to make a decision on stopping a medication. It was the first year that I was on one of the genetic modifiers for cystic fibrosis that have been very important in the new meds that we've been getting. And in August of that year, HealthWell notified me that if they filled that prescription that month, that was going to be using up all and a little bit more of the money that I had in my grant for that year. So I didn't really have any choice. I had to make the decision that I was going to come off that medication. And I say I didn't have any choice because with Medicare and Medicaid or main care, we're prohibited from getting any assistance for our drugs from the pharmaceutical companies. So to be able to continue to afford my pancreatic enzymes that I need for digestion, and to continue with my inhaled antibiotics that have been very important to me, I had to stop the genetic modifier. Having this program in place for the people in Maine with CF can help some people infrequently not have to face making that decision. I mean, sometimes we are deciding that we need to cut the doses that we're taking. We may skip treatments. I know some people have had to not perhaps have doctor's visits or labs or x-rays that they really should be getting, but they simply don't have the money to do that. And this program would help be able to afford them that opportunity. The program also really helped me. It did help me with my copay assistance for medications, but at the time, it also allowed me to start seeing a counselor. And that was for the anxiety and depression that I suffer at times because of having CF and having such an expensive and serious disease. That happens. And it was hugely helpful for that. So this program can help many families in the Maine CF community by serving as a safety net, covering some of those expenses, and hopefully allowing them to not have to make some of the detrimental decisions that are being made. You know, it's hard enough when you're doing it for yourself, but if you're making those decisions for a loved one, a child, I can't even imagine what that's like. So I
Thank
do
you for your
encourage you to
testimony.
continue the program. Thank you.
So are there any questions for our person offering a personal view of what this is all about? So thank you for that. I don't see any questions, Ms. Ridian, so thank you very much.
Thank you.
Next, we'll go to Ms. Atchison. Welcome.
First, thank you for your time. My name is Erica and I am from Dresden. I am a wife, a teacher, and a cystic fibrosis fighter. I get up at 4:20 in the morning to do breathing treatments before heading off to work, and I do additional treatments before supper. I take 14 pills with my breakfast and 8 to 10 more pills throughout the day. I am constantly snacking in an effort to take in as many calories as possible. Sometimes I am teaching with a fancy little fanny pack, giving me antibiotics into my arm because I'm sick, but I don't want to miss time with my students. I was very grateful for the Maine CSHN CF Assistance Adult Pilot Program because it enabled me to afford my medications, hospital visits, and specialist copays. I am living with a progressive disease that will shorten my lifespan, and I am grateful for the expensive specialized medications for my CF mutation that help me remain stable and have more time with my husband and students. I also have CF-related diabetes with an insulin pump and a continuous blood glucose monitor, which are quite costly. Not all people with CF are eligible for Maine Care, and I am one of those people. Although I work full-time and have insurance through my work, I have deductibles to meet before insurance will step in. The Maine pilot program helped me with the enormous cost of living with CF and filling in the gaps. My monthly medical bill is about $77,000. I'm worth it before insurance and the pilot program. 60% of my reimbursements from the CF pilot program were for medications to keep me healthy and out of the hospital, to help me continue to contribute to society and teach little kids. The program helped me with pre-transplant visits to Boston as well, which was a huge relief for me. I didn't need to worry if I could afford to go to Boston and even see if I was a candidate for transplant. I was able to pursue appointments there and make well-informed decisions about my future, which everyone should be able to do. I am worried. My lung function is 21%, and I have had to make tough choices since the pilot program ended. I am trying to stretch out my medication, scheduling doctor's appointments as far apart as possible to delay copays, and I am postponing blood work and other important tests because of the financial impact. I have looked for other programs to help me to fill in the gaps that the pilot program had covered, but I do not qualify for the few that exist.
30 seconds.
This bill would restore my eligibility for the pilot program and enable me to make the right choices for my health, not either or choices with medications and tests. It is critical that we have strong, effective, comprehensive medical coverage without gaps for people with CF. I have made it to 45 years of age. Please help me celebrate many more birthdays. Again, thank you.
Thank you for being here, Ms. Atkinson. Any questions? I don't see any. We'll move to Ms. Griffiths.
Good morning. Can you hear me?
We can.
Good morning. Thank you for this opportunity to speak in support of the LD 529 bill. I'm going to read because it's an emotional topic. So my name is Sarah Griffiths. I live in Falmouth with my husband and our daughter, Mamie. I'll hold up right here, who is 10. Like many of her peers, Mamie loves her friends, she laughs easily, and she has really big ideas for her future. But unlike her peers, Mamie has cystic fibrosis. Living with cystic fibrosis is a complex and expensive experience. It requires medical equipment for daily treatments, multiple prescription drugs, routine testing, and x-rays. Mamie sees her doctors at the CF clinic at Maine Medical Center multiple times throughout the year, and above and beyond her appointments at the clinic, We have regular appointments with gastroenterologists, ophthalmologists, endocrinologists, ENT specialists, and at times to manage anxiety with a therapist. This treatment and care regime can be expensive, even for families like mine who do have private insurance. Despite having the benefit of a comprehensive insurance plan, our family spends between $8,000 and $10,000 out of pocket annually for Mamie's care. We quickly met the Maine Children with Special Needs Program cap for a reimbursement of $3,000, which we use to offset the cost of copays of medications, office visits, equipment, and hospitalizations. With the assistance of this program, we didn't have to shoulder the entirety of that financial pressure, and we were so grateful for the support. In Mamie's lifetime of 10 years, therapeutic advances and new medications have transformed cystic fibrosis. The year she was born, the median lifespan was 37, and today it's 44. Imagine that, a gift of 7 years of life. We are confident that the outcomes for Mamie and others living with cystic fibrosis will continue to improve with more advancements and high quality care. And that's why I'm urging you to pass this bill and restore funding for families and adults with CF in Maine, regardless of their income or insurance. No family should have to make difficult decisions related to accessing healthcare because of the financial burden of this disease. I'd like to take a quick minute and personally thank my local representative, Teresa Pierce, and Senator Kathy Breen, who took the time to correspond with my husband and I and stepped forward to co-sponsor this bill with Senator Ann Carney. Thank you all for your time and consideration in support of this bill.
Thank you for being here, Ms. Griffiths. It's important to get these perspectives. So I appreciate your being willing to step up. Are there any questions? I don't see any. I understand there are a number of folks here to testify neither for nor against. And Ms. Corrigan, if you want to start and join us.
Good morning. I am Mary Ellen Corrigan. I'm a nurse practitioner, having worked in the cystic fibrosis clinic for over 25 years, and wanted to answer a few questions and give a little historical perspective. Cystic fibrosis has changed over the years. When I first did this, we had no adult clinic. We now have a larger adult clinic than a pediatric clinic. The cost has gone up exponentially. Initially, and for many years, families with chronic illnesses like cystic fibrosis were supported with the Children with Special Needs program, which was a federally funded program through Medicaid that covered copays and extra costs for all families of middle income who did not qualify for main care. That program disappeared, which is how the pilot program came to be. It was developed to support these families. Many other chronic illnesses have funding through the state to assist with the cost of care, and with the loss of the Children with Special Needs program, cystic fibrosis lost that. With the advances in science, the costs have gone up incredibly for care at home and maintenance of medication and treatments. If we could compare costs, the amount of hospitalizations have also decreased incredibly with the onset of the new CFTR modifiers, which are some new medications available at a very high cost. I was incredibly disappointed to hear the first adult speaker say she cannot afford these medications, which are life-changing in cystic fibrosis. But people are making those decisions every day, especially in the adult population, in families who have children with CF. Do I pay my heating bill, or do I take my child to clinic or get these medications? These programs don't cover everything, but it's a Band-Aid and it's a lifesaver. It's not a lot of money statewide, but it's for these families, it's an incredible lifeline. For the duration that we had that CF pilot program, it made a huge difference in many families' lives to be able to get the care to keep their children and to keep adults healthy with CF.
Thank you for that testimony, Ms. Corrigan. Are there any questions for her? I don't see any. Thank you for being here. Now, Ms. Cronin, if you want to unmute and join, we'd be glad to hear from you.
Hi, thank you very much. Senator Claxton, Representative Meyer, and distinguished members of the Joint Committee on Health and Human Services. My name is Nancy Cronin, and I am the Executive Director of the Maine Developmental Disabilities Council. I stand neither for nor against this bill because it focuses on just one population of children and adults with special health care needs. I'm going to focus mostly on children and youth with special health care needs in my presentation. When there are many children, youth, and families with low incident health conditions in the need of CDC's attention and money, cystic fibrosis is one of these low incident health conditions. But there are others, such as cerebral palsy, Lowe syndrome, muscular dystrophy, spina bifida, chromosomal disorders such as Down syndrome, neurological disorders, and many, many more. Maine receives Title V Maternal Child Family Federal Block dollars. A significant portion of the block grant is to go to the Children and Youth with Special Health Care program. In most states, that program is elevated to represent all children and youth with special health care needs across all public service systems. Unfortunately, recent years found that Children and Youth with Special Health Care Needs program was demoted to the lower office in the CDC. Also, unfortunately, and historically, the Maine Children and Youth Special Health Care Needs program was divided into specific disability programs as opposed to focusing broadly across overall systems to ensure representation across programs, quality health care, and care coordination for all children and youth with special health care needs and adults with very low incident disorders. The funding has been doled up in turns. A portion of funding and attention goes to the cleft lip and palate program. Another portion of funding goes to the newborn hearing and screening program. You've heard that in the past, it was a cystic fibrosis program. You get the picture. Unfortunately, the systemic practice left out the children with special health care needs, creating a group of children we served with funds and a group we don't. And this is contrary to what I believe public health is and what the block grant should be doing. It is not that I don't believe that children and youth and adults with cystic fibrosis need help. They totally do. But we don't have the resources to divide among every low incident disorder. And it's not fair to create a public health system that only serves some people and not others. It will create haves and have-nots. Or it creates a lot of people coming and saying, we need funding to support cerebral palsy, spina bifida,
30 seconds.
Lowe syndrome, etc. I thought about opposing this bill, but decided that this issue doesn't need to go away, but instead needs to be elevated. Please consider changing this bill into a legislative vehicle that would include a report back to you next session that identifies common low incidents for children and youth with special health care needs and adults in Maine, describe those unmet needs of children and youth for these different low incidence disabilities, and provide recommendations to meet the needs, which may include a whole range of things, including policy changes in the tax and the insurance sections. I appreciate the opportunity to speak today and would be happy to take any questions.
Thank you for being here. I don't see any questions, so have a good rest of the day. Now we'll go to Ms. Morrison, if you want to unmute and join us.
Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Stacy Morrison. I'm the mother of Zachary Bowman, a 15-year-old with cystic fibrosis. Thank you for the opportunity to talk today. I'm here to support LD 529. Zachary has been on a medical regimen since birth that includes ongoing medical visits to the specialty CF clinic in Portland, other CF disease-related specialty doctors, various testing, oral inhaled medications, physical therapies, utilizing a special airway clearance vest and nebulizer machine. In addition to this, he requires regular exercise and a diet high in fat, including nutritional supplements. I am fortunate that I have a PPO insurance plan through my small business. Unfortunately, to keep the health insurance affordable to the business and my employees, we have always had to carry a higher deductible. Our parent-child deductible is $10,000, with a $13,000 out-of-pocket max for in-network medical costs. But remember, that deductible is only for medical-related costs that the insurance company would pay, not the copays, not the travel to Portland, the high-fat foods, the supplements, and the exercise. As you can imagine, Zachary's healthcare and related costs are not typical for a boy his age. For instance, Zachary has a new Monarch vest. It's much improved over the one that he's been using for the last 10 years. Our copay on this vest is $175 a month. And those nutritional supplements that he drinks, they're $12.99 a six-pack. He drinks about 4 a day, costing around $260 a month. The copay on his oral inhaled medications averages about $250 a month, but can be higher depending on his treatment at the time. I could go on with more examples, but I'm sure you understand what we experience. Before Maine Children's with Special Needs Program changed its eligibility requirements, we were able to participate and were reimbursed up to $3,000 for copays, travels to doctor's appointments, and the nutritional supplements. We typically used up to $3,000 reimbursement within 3 to 6 months. It was the only program that we qualified for through the state of Maine. I can personally tell you it made a significant impact to our family. I urge you all to vote to pass this bill. Thank you for your time and consideration.
Thank you, Ms. Morrison, for being here. I don't see any questions. So I appreciate your taking time from work and testifying.
Thank you.
We'll hear next from Jonathan Zuckerman. If you want to unmute and join us, sir.
Thank you very much. Thank you, Senator Carney, for sponsoring this legislation, and also thank Senator Clayton and Representative Meyer and members of the committee for discussing this important issue. My name is Jonathan Zuckerman. I'm a physician at Maine Medical Center, and as the director of the Adult Cystic Fibrosis Program at Maine Medical Center, where I've been directing the program for more than 20 years, I wish to lend my enthusiastic support for LD 529. You've heard the powerful stories of our patients and family members about how this funding would change their lives for the better. From a provider standpoint, I've witnessed the profound effects of personalized care on the health and well-being of our patients. This approach incorporates the unique challenges of each patient and their family into the care plan. And one important area where I've seen the CF pilot program help our patients within this care model is in the purchase of durable medical equipment, which is often not covered by conventional insurance policies. Durable medical equipment includes items like portable oxygen concentrators, airway clearance devices, high efficiency nebulizers, and accessories for feeding tubes. For instance, getting a portable oxygen concentrator for a patient can make the difference between being able to independently climb a flight of stairs on a family outing or being confined to home. Appropriate feeding tube accessories can make the difference between waking up in the middle of the night with wet bed sheets or being restored by a night of uninterrupted sleep. These are just two examples of how passage of LD 529 would make a world of difference to members of our community who fight cystic fibrosis every day. And I heard the testimony about other diseases which have not really advocated for this similar type of funding. And what it brings to mind for me is that CF Care has really been a model for many other diseases around the country. Just like the pilot program has helped us figure out what works for our patients, care of CF patients within a multidisciplinary care model is actually a model for other diseases. So I wouldn't say that by accepting this program, we're neglecting other patients. We're actually serving as a model for how we could potentially do that service for other disease processes and for other patients in the state of Maine. So thank you very much for your time, and I'm happy to answer any questions that you might have.
Thank you, Dr. Zuckerman, for being here to testify and for your efforts over the years. Are there any questions of Dr. Zuckerman? I don't see any. So again, thanks to everybody for being here. I'm not aware of anybody else who wants to testify for, against, or neither for nor against. So we'll conclude this hearing portion of the conversation about LD 529. Are there any questions we'd like to direct towards Ms. Dooling for the work session? Yes, Representative Perry.
Yeah, I was trying to read through Nancy Beardsley's letter with some explanations around the program that they had and what CDC does do. I'm wondering if it would be possible for the work session to have Ms. Beardsley join us.
Do you have some specific questions you'd want her to come prepared to ask? Or answer?
To elaborate on what she has in her laboratory.
Okay. Okay.
And
All
an
right.
opportunity to discuss that.
Okay. Representative Craven?
I wonder if we could have the results or an outline.
You're on mute again, Representative Craven.
Oh,
There you
so
go.
thank you. I wonder if we could have an outline of the pilot program that was in place before so that we could see how that worked.
Yeah, yes, Representative Zager.
Thank you, Mr. Chair. I was wondering if we could maybe get a estimate from the Maine Revenue Service of what a 30-year, what a nurse, what a teacher over the course of 30 years would be contributing in taxes to Maine's economy.
Okay. Representative Javner.
Thank you, Mr. Chair. So I see that the preliminary fiscal note is 500,000 from the general fund, and I would like from the department to know what the actual amount is for the Title V, the Maternal, Child, and Family federal block grants, how much that is, and also, you know, how it is encumbered, the funds and where they're going. Thank you.
And if it's readily available, it'd be nice, as far as I'm concerned, to have a list of other low incident pediatric diseases that do get some coverage and those that don't or once did. Representative Stover.
Thank you, Senator. I would like to, along the similar lines of what you just said, Senator, if we could have any sort of review included about EPSDT and whether for minor children, whether EPSDT funds can be used for some of that DME and or other things that people described that they needed to take care of their children. Thank you.
I was astounded to see in a review of the recent spend by the state employees group that 2 of the top 25 drugs were cystic fibrosis drugs. 2 of the top 25, millions of dollars a year. But we now know why. Any other questions? Is your hand still up, Representative Stover, or is it not gone down? All right. Do you need any clarification of that, Ms. Dooling? Okay. So that'll conclude the hearing portion or the public hearing portion of LD 529. Now we can move to LD 601 and hear from the sponsor who just entered the room. Welcome, Senator Miramont. So if you want to unmute and join us, Senator Miramont, we'd love to hear about this bill.
Thank you. Can you hear me, Senator?
A little bit.
I know it looks a little spotty, but hopefully it'll get better. I'll shut off this other computer with my Prime committee. And how about that?
Can everybody hear okay if they adjust the volume up? All right.
Oh boy.
I turned my volume up as much as I can and I can't hear you. I can hear you. Okay, Senator Miramont.
All right. Well, I can also.
No, that's okay.
Okay. All right. Thank you, Senator. I'll speak up as well. I am presenting testimony for LD 601, an act regarding indices of vital records. That is correct, isn't it?
It is. You're in the
good.
right committee.
So good morning, Senator and Representative Meyer, distinguished members of the Health and Human Services Committee. I'm Dave Mearmont, and I proudly represent all the people of Appleton, Camden, Creehaven, Cushing, Friendship, Hope, Isle Ho, Matinicus, Muscle Ridge Islands, North Haven, Owl's Head, Rockland, Rockport, South Thomaston, St. George, Thomaston, Union, Vinyl Haven, and Warren in the Maine Senate. I'm here today to present 601, and regarding that, the cataloging of and creating access to our public records is an important task. The folks who developed the language of this bill have taken up that task and are trying to keep up with the technology as it changes. In the past, it was necessary to go to an archive and do hours of searching. This is often done for free as a way to benefit individuals or communities. As technology changes, it can be easier to do research with a computer as long as the proper safeguards are in place to protect information, while at the same time allowing access to the persons who need it. This bill has been presented previously by me also, so I've been involved in the communication before. And folks testifying have raised questions that have been answered with the current version.
We just lost you, or I did. I guess we're not hearing you, Senator.
That should be shared with them directly. I also have
That's
noted
better
from
again.
other-
Yeah, we lost you for a while, but now I can hear you again.
All right, well, I submitted my written testimony and I just read it, but in addition, I've noted that it should be noted that indices to vital records or public records do not fall under the embargoes for the records themselves. And it's been proven over and over that identity theft and fraud do not come from persons being able to access vital records. Also, that there was an LD 24 that was voted ought to pass by your committee in February and was supported by HHS in testimony by Kim Hagan, Director of the Division of Data Research and Vital Statistics. In LD 24, Section 2A, it states that the names of the parties for whom intentions to marry are files and the intended date of marriage filed and the intended date of marriage are public records and open for public inspection. So if there was no objection then, I'm surprised they would be objecting now, or maybe it's some misunderstanding by one of us, that could be. I'm glad to have it cleared up, but I would like to have it cleared up because it seems they're objecting to the very thing that they've already testified in favor of. And as usual with this one, I'm glad to answer questions. However, Helen Shaw has worked tirelessly on this for years, and you came over from the other committee too with this. So I trust it'll get a great hearing and that you should ask her the questions, but I'll try if you have any.
Thank you, Senator. Are there any questions for Senator Mearmont? I don't see any. Looks like you're off the hook.
Thank you, Senator. I'll be listening.
Ms. Shaw, if you would like to unmute and join us.
Okay, thank you, Senator Claxton. My name is Helen Shaw. I live in Rockport, and I am the past president of the Maine Genealogical Society, one of 3 certified genealogists in the state of Maine, and Maine's representative to the Records Preservation and Access Coalition. You have my written testimony, and in addition to that, I would add that LD 601 it protects vital records indices by decreasing hands-on public inspection. This means the municipalities will not have as many people coming in, looking at them. They will not have to provide staff to watch the people. There is no confidential information or anything that could be used to fraudulent purposes in LD 601, the information that's released. Fraud and identity theft are more likely to come from improper access to computerized medical records, credit card theft, the hacking of bank, credit card, and business databases, and trolling on social media sites. Less than 1% of identity theft and fraud comes from improper access to vital records. LD 601 does not allow access to vital records. Only the names, dates, and places for marriage, deaths, and births are accessed in the indices. This information has been posted on internet, published in newspapers, reported in town records. Go home and Google your name. You'll be surprised what you find out there. Personally, I found my last 2 places of residence and phone numbers, my name of the high school, town, and graduation year, a newspaper article on my first marriage with names, date, and place, and my name in the obituaries of my parents, and on and on. Names, dates, and places of events are public information. As Senator Miramont mentioned, LD 24 states that for marriage intentions. So why is there an objection to having the same information available for to the public for deaths, births, and marriages? Access to the indices by a private entity would not be through the HHS portal. It would be the entity's copy, and you access it through that. I did have a state researcher ID card last year and accessed for birth records.
30 seconds.
Birth indexes are not available. So I don't see anything, again, you've got my written testimony. I don't see anything in LD 601 that affects privacy or fraud. Thank you.
Thank you, Ms. Shaw, for being here and for your expertise. Are there any questions of Ms. Shaw? I don't see any. So now we'll hear from Ms. Bogart.
Good morning still. HHS Committee, Senator Claxton, Representative Meyer. I am testifying in opposition and to bring your attention to a letter from Deputy Director Nancy Beardsley. Since I am not any kind of expert on this, I am just going to read the letter to you and know that Kim Hagan, our state registrar, as well as others from CDC will be available for the work session. So as you've heard, LD 601 proposes that indices of certificates and records of marriage, intentions to marry, domestic partnerships, and death, including fetal death, from 1892 to the present, and at municipal and state levels are open to the public without restriction, and that indices to certificates of records of birth at the municipal and state level are open to the public after a period of 75 years from the date of birth. The bill also requires the state registrar to enter into a long-term, non-exclusive contract with a private entity to create, maintain, and update an online index to certificates and records of birth, death, marriage, intentions to marry, and domestic partnerships, including and death, including fetal death, in exchange for allowing the private entity to also provide that index to its subscribers and customers. Vital records are administered by the Data Research and Vital Statistics Program within the Maine CDC, and DERVS is responsible for maintaining the centralized statewide system of vital records. We're also the custodians of Maine's vital records starting from 1892. We're responsible for the proper administration of the system of vital statistics and for the preservation and security of those official records. In 2011, we undertook a major process to digitalize 3.9 million records in order to make sure that they are properly preserved. And in October of 2018, we adopted rules to provide guidance for vital event registration, issuance, security and fraud prevention, and protection of confidential information in the electronic environment. All of these indices are currently available through DERV's online portal. The portal is accessible to municipal clerks as well as genealogical researchers who've applied and been issued a state of Maine genealogical researcher identification card. Registered genealogical researchers can request up to 3 non-certified copies per week, electronically or by mail. for a $50 annual fee. We maintain strict privacy and confidentiality practices and believe a private entity should not be able to have unrestricted access to our portal containing restricted information or allow their subscribers or customers to access that information. We have privacy concerns that the data or information could be used in fraudulent ways, including identity theft, and vital records contain personally identifying information that's not appropriate to share with the general public. Some of the indices maintained by municipalities have records that are public and restricted filed together in the same place. Municipalities do not have staff to oversee that individuals are only receiving the public records, and the department would not be able to monitor that process. So given all of that, we respectfully oppose this bill and are more than happy to provide additional information at the work session.
Thank you, Molly. Are there questions, Ms. Bogart? I don't see any, so appreciate your being here, and we'll look forward to the work session with Ms. Beardsley and some of the other crew to try and address any concerns. So that'll conclude this portion of our public hearing and our work on LD 601. Are there questions of our analyst for the work session? I don't see any. I'd like to understand the specifics of that technical concern about access to the DERVs. Is that the abbreviation? DERVs. And have a better sense of whether that's something that we should be super concerned about. So that was the only question I had. That's really an IT question. All right. Thank you for being here, Senator Miramont. I don't see any other questions, and we'll conclude now, and we'll move to Aaron to see if there's any additional work to be done in the morning.
I don't have anything for you. You have public hearings, more public hearings beginning at 1.
Right. And as long as we're having this conversation, and so that I don't have another opportunity to mess it up, is there any particular order in which we know they're supposed to be going?
I'm unaware of any requests. Nobody's
How about
contacted
you,
me
Ms.
about
Whitby?
it.
Have you gotten any requests?
I haven't received any requests either.
Senator Moore?
Yes, I had one request for LD 614 to be the last bill at Representative Toole's request.
Ah, yes, I do remember that.
Yeah.
Okay. And LD 727 has been sort of off again, on again in the background, but it's on again, and we're expecting testimony. So I just want to flag that for people who, if they've heard any of those rumblings. So we'll move 614 to later, to the end of our agenda. And other than that, we'll hear them in order, and I can turn over the chair to Representative Meyer when I present my bill. Yes, sir, Representative Connor.
Thank you, Mr. Chair. I just wanted to let you know that for the record, I did record my vote from yesterday. I want to say thank you to Anna for sending me that email.
Yet another instance of how fortunate we are in this committee.
I'll let her know. Thank you.
All right. Any other comments before we entertain a motion to adjourn for a lunch break? What a concept.
So moved.
Oh, I did. Okay, very good. Well, we have some things to do at the end of the day. Just a couple things to touch base about. But so there's a move to temporary suspend until 1 o'clock and a second.
Second.
A lot of everybody second. That counts as universal acceptance. Thank you all. We'll see you at 1. Hey, Sam. Sam, does this make a lot of noise? Okay.
The paper shuffling?
Yeah, I didn't realize how bad it was until I got called on it in the committee the other day. I was moving my notes around and Representative Connor was generous and didn't.
I was trying to send you a text message in a chat to say you might want to move your papers away from your laptop
I
microphone.
might want to put them down and let go of them is what I might want to do. Yeah. Sorry about that. Ms. Withy, do we know of anybody who wants preferred status this afternoon?
I haven't received any additional requests.
Okay, so we're going to go with what's there.
Except for Representative Toole, who
Moving
wishes to be at the
614.
very end.
At the end. With the required report on the status of Route 9. He used to regale with that every state and local. He came in every Monday. He would give us a blow-by-blow description of the terrible drive up 9 in the winter.
Well, be prepared because he has been informed and he's ready to roll.
I am ready. Looks like we have a quorum. So I'll welcome folks back to the afternoon session of the Committee on Health and Human Services. We'll be hearing an additional 6 bills this afternoon. And as you're testifying, please make sure that the name that we have under your picture matches with who you are. It'll be confusing and we're likely to mess up identifying who's speaking. We'd also ask that you limit your testimony to 3 minutes, which is about 1.5 pages of typed material. And we'll be using a 3-minute clock after the bill has been presented. And we'll give you feedback with a 30-second warning. So as long as we're here and we have a number of bills to hear, why don't we quickly go around and reintroduce ourselves. This time I'll start with Representative Griffin.
Good afternoon. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levan, and Cadescate.
Representative Connor.
Thank you, Mr. Chair. Good afternoon, everyone. My name is John Connor. I represent House District 58, which is the part of Lewiston.
Representative Craven and Green.
Thank you, Mr. Chair. I'm Margaret Craven and I represent House District 59, which is part of Lewiston.
And Representative Madigan.
Good afternoon. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Representative Zager.
Thank you. Good afternoon, Mr. Chair and everyone. Sam Zager, District 41 in Portland.
And Representative Lemlin.
Good afternoon, everyone. My name is Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good afternoon. My name is Holly Stover. I represent House District 89, including the towns of Boothbay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol.
Senator Baldacci is tied up in state and local currently. Representative Perry.
Oops. Good afternoon. I'm Representative Ann Perry. I represent House District 140, which includes the towns of Indian Township, Baileyville, Bering, Calais, Charlotte, Robinson, Perry, Pembroke, and Pleasant Point.
And Representative Javner.
Good afternoon. I'm Representative Kathy Javner, and I represent House District 141, which is located in Penobscot in Washington County.
We should give you an opportunity to describe the towns once a week or something like that, so that it's such an amazing list. Senator Moore. Oh, there she goes. Senator Moore, we're ready for your intro if you are.
I'm sorry, I apologize for that. Good afternoon. This is Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Great. And Representative Meyer?
Good afternoon, and thank you for joining us this afternoon. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is parts of Kittery and South Berwick and all of Elliott.
And I'll extend my thanks too. I'm Ned Claxton. I represent the folks in Senate District 20, which is Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. So as we said before, we're mostly going to be hearing the bills in order. So we'll start with 250, but the only change in the sequence will be to hear Bill LD 614 at the end at the request of Representative Toole. So those folks who will be testifying for LD 250. And will our own Representative Perry be presenting that? So she must be getting her script. She was here a minute ago, wasn't she? So for those of you who are just joining us, in addition to listening, you can also see us on the YouTube channel, which is legislature.maine.gov. Go there, look for the Health and Human Services Committee. We have our very own YouTube channel, and you can watch us live or you can watch recorded sessions there and catch up on anything you missed. So we're trying to catch up with our first presenter. Oh, there she comes. Welcome back, Representative Perry. You're still on mute. You're still on mute.
Oh, yes. I just had something I had to take care of, sorry.
we were thinking that you were going to present LD 250. Is that correct?
I am. Oh, is this now?
It's now. Now is now, yes. Now you're on mute again. Step away from the mute button.
There we go. How is that?
That's much better.
Okay, good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. I am Representative Van Perry, and I represent 9 communities in Washington County. I am here to introduce LD 250, an act to assist nursing homes in the management of facility beds. We are at a critical point in nursing homes, and nursing homes have been hit hard on a number of levels. We've had nursing homes closed over the last 4 or 5 years, and also through the COVID epidemic have been hit hard. LD 250 takes several steps that would solidify the environment of nursing homes that nursing homes operate in. It would, 1, reinstate bed banking. Prior to 2007, nursing homes were allowed to temporarily take beds offline, but bring them back when future needs increase. Nursing homes are penalized when their occupancy falls below a certain level. In those situations, it may make sense to decrease the number of available beds. But looking at future demographics, it would be short-sighted to eliminate beds permanently. This bill restores an opportunity that was in nursing home regulations for many years. 2, it would eliminate the cap on the amount paid to physicians serving as nursing home medical directors. Currently, Maine Care will only allow a salary of up to $10,000 per year. In 2015, the average cost was more than double that, and facilities struggle to find physicians willing to serve as medical directors. The limitation on these payments is a cap with a cap, as nursing homes will still have to stay within the overall routine cap. The ceiling on medical director pay is an unrealistic limitation and unnecessarily micromanages nursing home operations. 3, currently reimbursement for cloud-based software is treated differently than older technology. This is to the financial detriment of nursing homes. At the time that the principles of reimbursement were written, no one could have envisioned these kinds of changes. According to LD 250, brings reimbursement policy up to date with how software is now obtained. I want to thank you for your time and consideration, and there will be people behind me who can much more easily answer questions you may have, but I will take questions if you have any.
So does anybody have questions for our Representative Perry? I don't see any yet. Okay. Welcome, Mr. Erb.
Thank you, Senator. Good afternoon, Senator Claxton, Representative Meyer, members of the committee. My name is Rick Erb, and I am the president and CEO of the Maine Healthcare Association. Our organization represents nursing homes and assisted living facilities. I am pleased to testify in support of LD 250 today and thank Representative Perry for sponsoring it. As she mentioned, until 2007, nursing homes were able to participate in the program that allowed them to temporarily take beds offline while reserving them for use at a later date. So-called bed banking makes sense when a facility is experiencing a lower occupancy rate. A reduced census will bring on occupancy penalties and in some circumstances negatively affect rate calculations. In 2020 and 2021, we have seen what I believe is a temporary decline in occupancy that is directly related to COVID-19. Independent studies have projected that Maine will struggle to meet future demand for long-term care facilities of all types. Temporarily delicensing beds now makes sense in these circumstances. Maine went through a period of 18 months where we lost more than 250 nursing home beds through closures. We already had the lowest number of beds per 1,000 people over age 65 in New England. In these uncertain times, I believe it's important to preserve the capacity that we have. Nursing home reimbursement for medical director compensation is currently capped at $10,000 a year. This expense is included in the routine component, subject to its own cap. So yes, this is indeed a cap within a cap. Based on 2019 audited cost reports, we know that the average cost was approximately $30,000 per year for nursing homes. A large facility in an urban area is likely to be paying several times that amount. Many facilities struggle to find a doctor willing to take on these duties, which have been growing even before COVID-19. Nursing homes would still have to live within their overall routine cap, but we would ask you to eliminate this further restriction. The bill also addresses reimbursement issue brought about by a change in technology. Nursing homes are reimbursed for certain software purchases as a fixed capital cost. However, when most of the acquisitions became cloud-based, DHHS audit rejected them as fixed costs, putting them under the routine component, where many facilities have already reached their cap. We urge the committee to make this adjustment, simply keeping up with technology. In closing, this committee has historically supported all of these initiatives. The efforts have been stalled once released from this committee for a variety of reasons, such as funding availability, and more recently, last year, due to the pandemic. I hope you will support these measures again, and thank you for the opportunity to testify.
Thank you, Mr. Erb. Are there folks who have questions? Yes, Representative Craven.
Thank you, Mr. Chair. I'd just like to know, if a bed is taken offline, is there is there like some kind of longevity term that it's or can you bring it back online when you need it?
I believe it is indefinitely banked for later use. There is a requirement, although there is a requirement to renew that banking every year. It's a matter of notification, saying we know we still have the bed online, which in the bank, we still want to keep it there. So thank you.
And do those beds become unlicensed? You referred to licensure. You don't lose licensure on a bed if it's banked, do you? It's just sort of put in mothballs.
It's exactly that. And as you may be aware, there's quite a process that facilities have to go through under certificate of need. So if they were completely delicensed, that would be a very involved process to bring it back.
Okay.
This avoids having to do that.
Are there other questions? So the ask of the bill is to remove the $10,000 limit on provider coverage because the overall expenses for the nursing home are already limited.
Yes.
And
you're referring to the medical director's salary?
Yes. Yes. And this would allow you the flexibility to negotiate whatever compensation you needed to keep somebody in the house.
There are a handful of expenses that have a cap within a cap. I mean, one that probably makes slightly more sense would be the administrator's salary. I can understand why that's a concern, that you don't want to see excessive salaries. But the fact is that $10,000 for a year's service from a licensed physician, that figure has not made sense for some time. I mean, I think in looking back, there was a time, particularly in the rural areas, where the town's physicians sort of took that as part of the job. But things are different.
Okay. Yes, Representative Zager.
Thank you, Mr. Chair. Mr. Erb, thank you for testifying today. Can you give us some sense of why that cap was instituted in the first place?
Long before my time, I think that they chose certain expenses that, from a regulatory point of view, they wanted a control over. The ones that come to mind, as I said, one is the administrator's salary. Another is the fee that is paid to the CPA firm that does the financial work. There's a cap on that as well. There's one for this one. This one, to me, appears to make the least sense of all.
Senator Moore.
I'm just curious, thanks for being here. Is there a Medicare cap on the salary for the medical director?
No, the reimbursement through Medicare is so different that no, that there is not.
Huh, weird.
Yep.
Okay, thank you.
Just really quickly for the committee's benefit. Medicare is paid more in a lump sum for services. There is nowhere near the amount of oversight and management that goes with the Medicare payment. It's really up to the facility to manage.
And have you done any modeling with any of your entities to find out what the impact would be of changing how the software contracting is treated?
As far as an estimate of what the fiscal note would be for that?
Or positive impact to the nursing home or fiscal note overall?
So yeah, No, but I can report back for your work session on that. I can tell you that this basically is, it shouldn't have a big impact because for years they were buying software off the shelf and being reimbursed as a fixed cost for that. So it should be the same as it ever was, but I will gather some of that information.
And the argument is you can't run a nursing home without some sort of software to make it happen. And that makes it a fixed cost.
It does.
That's non-discretionary. Okay.
Yes.
Are there any other questions for Mr. Erb? I don't see any. Thank you for being here. Thank you for bringing this forward, Representative Perry. I don't see anybody on the list speaking in support of, or against, or neither for nor against. So that'll conclude the public hearing portion on LD 250. And we'll come back to this with some additional information for our work session. Are there any questions we want to ask of Ms. Broom before we conclude this piece? Any information anybody needs for Anna to pull together? I don't see any, so I think this one should be a little easier than some. Okay, so if we're ready, we can move then on to LD 485. That seems to ring a bell. So I'll turn the chair over to Representative Meyer and look through my computer real fast and see if I can find my notes. I'm ready when you are, Chair Meyer.
I am ready right now.
Very good. So good afternoon, Chair Meyer and respected members of the Joint Standing Committee on Health and Human Services. My name is Ned Claxton, and I represent the people of Senate District 20, including the towns of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. By providing an annual appropriation of $1.5 million, LD 485 recognizes, continues, and expands support for the work and contribution of our 5 main area agencies on aging. Through their Meals on Wheels program, the agencies have fed thousands of older Mainers during the COVID pandemic, and many more than usual. In a typical year, there are already too many older Mainers who are food insecure. In those times, a year ago, Meals on Wheels typically has a waiting list for their service. In the past year, the number of those who qualify for this service has increased at least 50% for the agencies, and in some cases more. And the AAAs, the Area Agencies on Aging, have stepped up to feed their communities. They organized and reorganized their food production process. They found new and younger volunteers. They more closely partnered with food banks, and they provided thousands more meals at a time when many were struggling to get enough to eat. We knew there was food insecurity in Maine. The pandemic has further exposed its breadth. My AAA, Seniors Plus in Lewiston, ended up serving almost twice as many people as it usually would. They all qualified for the service, and they all received up to 7 meals a day, prepared and frozen to help get through. In addition to the direct benefits of feeding hungry people, this program, with the many associated supports that the agencies provide, helps stabilize the health of its recipients and helps keep some of our most vulnerable people out of nursing homes and hospitals. In addition to supplying prepared meals, the agency usually also provide a wellness check on recipients and an opportunity to socialize. Much of that work had to move to virtual in the last year, but the work of getting the meals to people continued. These are crucial lifelines for some of our seniors and can help prevent the need for more expensive services. Temporary funding and increased donations have helped the agencies address the needs in the past year, but those funds will eventually disappear or decrease. The need will not. And it's for that reason I ask you to support LD 485 and the impressive and crucial work of the area agencies on aging. Thank you for your attention, and I would be happy to try and answer any questions. There are folks much more knowledgeable than I to follow.
Thank you, Senator Claxton. Any questions from the committee for the senator? The bill's sponsor? Seeing none. Up next is Representative Jessica Fay. Welcome, Representative Fay.
Thank you very much, Representative Meyer. And I may be a little rusty. This is actually my first time testifying this session. So I'll try to be quick and concise. Senator Claxton, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. I'm Jessica Fay, representative for the people of House District 66, which is parts of the towns of Casco, Poland, and Raymond. And I'm here today testifying in favor of LD 485 because Meals on Wheels offers an incredibly high return on investment. In past years, the legislature has recognized the importance and value in funding home delivered meals for older Mainers, and we should continue that support going forward. The numbers of people accessing this program, efficiently implemented through Maine's area agencies on aging, have doubled during the pandemic. Many of the new program participants had been eligible prior to COVID-19, but had chosen not to participate or even realized that they were eligible. Increased access to federal funding has allowed these folks to be served without a wait list, and it is our moral obligation to make sure that when this crisis is over, eligible folks can continue to receive home delivered meals. Doesn't it make sense to include the one-time funding requested each biennium in the baseline budget going forward? We cannot continue to depend on federal relief funds that will eventually end to fund anticipated ongoing need for necessary services. But the value of Meals on Wheels doesn't just lie in access to nutrition. Many of us have a better understanding of the negative health impacts of social isolation now than we did prior to the pandemic. That weekly visit from a volunteer, even a socially distanced visit, can act as a lifeline for homebound older adults, helping to connect them to the outside world. Meals on Wheels helps older Mainers remain independent and in their homes. During the time when the legislature wasn't in session, I was one of 838 volunteers who delivered Meals on Wheels. And I know there are other legislators who did so as well, including Senator Moore. What I learned as a volunteer was how important that weekly check-in is. One week, I found a meal recipient had fallen and was unable to get up. They had been on the living room floor for at least 15 hours when I found them. I called rescue and they were transported to the hospital. With no one nearby checking in daily, I'm grateful that I arrived when I did. This individual could have been lying there alone for days or even died alone, if not for a meal delivery. And this isn't a unique incident. And I learned a great deal from the folks I delivered meals to. I met their dogs and cats, listened to their stories from a distance, of course, and even got to know what their favorite meals were. I think I benefited from these interactions as much as the folks I delivered meals to. So Meals on Wheels provides nutrition, health, and social benefits, and I encourage the committee to recommend this funding so that all homebound people who are eligible have access to this life-saving program. Thank you for your time and attention, and I'm happy to try to answer any questions.
Well, thank you, Representative. Questions for Representative Fay? Seeing none, enjoy your day. Up next is Mr. Dan Moore.
Good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee, and thank you for the opportunity to speak in support of LD 485. My name is Dan Moore, and I'm a retired member of the United States military, having spent 36 years in service to our United States Air Force. Following my retirement from uniformed service in July 2018, it wasn't long before I felt the need to re-engage in some form of service to my community. And in December of 2020, I found my opportunity through the Eastern Area Agency on Aging, located in Brewer, Maine, in the Meals on Wheels program. Currently, I volunteer in both the packing and preparation of meals for delivery, as well as delivery of those meals to our consumers. My experience to date has been both heartwarming and humbling. The staff at Eastern Area Agency on Aging are committed and passionate about serving our growing elder population, and their compassion has been evident in every interaction I have had with them and in every interaction I have witnessed between staff members and consumers. My work there has brought me into the company of fellow volunteers who share my desire to ignore all the negativism and talk of division in our world today, and instead commit to bringing about a greater good for our community. I believe our work with Meals on Wheels serves our positive mental and emotional well-being. I am certain that those providing testimony in support of this bill will provide you statistics and facts about a growing elder population in our community, a burgeoning demand for additional meals due to COVID restrictions, and ongoing food insecurity issues in our state. What you may have a more difficult time qualifying or quantifying is the difference this program makes in the mental, emotional, and social welfare of its participants. I have been told by some I deliver these meals to that I am the only other human face they have seen all week. Some thank me when I inquire as to their recovery from recent surgery. Others want to tell me about a phone call or an email they recently received from a family member or a friend they are currently apart from. Most seem to appreciate the fact that I remember their pet's name. Every week, that's wonderful, was the feedback I received from the newest addition to my delivery route when she realized we would have a weekly connection. I think this positive impact is best summed up in the words of one of my consumers who I had not seen or spoken with in over 2 weeks. I informed one of the agency staff members, and she immediately reached out and was able to make contact and confirm that all was well. Realizing what had happened, this consumer replied, "Aren't I lucky to have so many people who care about me?" Ladies and gentlemen, your support of this bill will ensure the continuation of a program that provides much needed sustenance to the hungry, while also feeding the mental and emotional well-being of all who participate in it. Thank you for your time and your consideration.
Thank you, Mr. Moore. Questions from the committee? Seeing none, we thank you for your testimony and for your service to the country and your community.
Thank you very much.
Next is Amy Gallant. Welcome.
Thank you very much. Good afternoon, Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Amy Gallant. I'm the Vice President of Public
We're having a little bit of a hard time hearing you, Amy.
Oh no, is it mute or just?
No, just come a little bit closer.
Hello.
Hi.
How's that?
That's better.
Okay. Well, I am Amy, and that's all you missed. And this is Diana, and she is a resident of South Portland. Good Shepherd Food Bank has a network of more than 500 partner agencies who support our mission to eliminate hunger in Maine by improving access to nutritious food for people in need, building strong community partnerships, and mobilizing the public in the fight to end hunger. Last year, through our work, we distributed 27 million meals across the entire state. And as a response to COVID, that increased to 35 million meals. This bill provides ongoing funding to provide home delivered meals to homebound seniors and to leverage all federal funds available. The COVID-19 pandemic has highlighted the importance of delivering meals to people at home more than we ever before realized. I remember about a year ago, I got a call from my friend Deb in Bath, and she's the director of an affordable housing organization, and she had started delivering pantry staples to residents' doors. Like her, most of our agency partners who provide food in communities continue to operate during the pandemic. About 93% of food pantries stayed open, and many of them moved to a home delivery model whenever possible. While some people have the time, resources, and ability to take ingredients and make a meal for themselves, we know that others, particularly older Mainers and Mainers living with disabilities, are better served by ready-to-eat meals that only require reheating. We are in ongoing discussions with a number of our partners who are trying to continue the home delivery model even after COVID, which is a significant shift from the traditional pantry model or the congregate meal model. It requires new resources, extra time, more space, and delivery resources. However, the Charitable Food Network cannot alone end hunger in Maine, no matter what the model of food delivery is. We must work in tandem with local, state, and federal government. This bill leverages all federal funds available for the state to increase the amount of meals delivered to homebound seniors. Good Shepherd Food Bank supports this funding allocation and urges you to do the same. Thank you for your consideration. I want to thank Diana for her very excellent behavior, and I'm happy to take any questions you might have.
Thank you, Ms. Gallant. Questions for Amy Gallant? And Diana, if you've
And
got one.
Diana, she's, yes.
Can't guarantee an answer back, but you can ask. Seeing none, she's for sure the cutest person providing testimony today.
Thank you. Thank you all. Good to see you.
Good to see you too. Up next is Mr. Harden. Mr. Harden,
Yes.
welcome.
Yes, I do get to follow a beautiful baby. So, Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Don Harden, and I'm the Vice Chair of the Board of Directors of the Maine Council on Aging. And I'm very happy to testify in favor of LD 485 on behalf of our many organizations, businesses, and older persons. We witnessed so many heroic and inspiring acts over the last year by so many Mainers. However, there can be no doubt that the actions of Maine's area agencies on aging to more than double the production and delivery of meals to older residents sheltering in place during the pandemic is one of the brightest spots. Thankfully, the federal government stepped up during this time, ensuring that Maine had temporary funding to support this effort, as well as providing broad flexibility in who could be served. As Dr. Shaw said in many of his briefings during the pandemic, when you go looking for things, you find them. For the first time, we went actively looking for older people who needed to receive home-delivered meals during the pandemic, and we found them. What we didn't expect was that nearly 2/3 of the new Meals on Wheels recipients who signed up during the pandemic would actually qualify for the program into the future. While it is good that older homebound people who need meals are getting them, this increased permanent demand coupled with an already underfunded program means we must find additional funding if we are going to continue to support the demand for this cost-effective program that yields big returns. Meals on Wheels is a targeted intervention that is only available to people 60 years of age or older who are homebound and unable to leave their home without assistance, unable to prepare a meal, and have no one available to prepare a meal. People who meet this criteria don't have family who can shop and cook for them. They aren't able to prepare food on their own, even if food is provided from a food pantry. While neighbors and community members might be able to provide a meal from time to time or even weekly, people who qualify for Meals on Wheels need daily nutritious meals in order to survive. While the federal government does not permit the program to be means tested, most Meals on Wheels recipients are very low income people who could not otherwise afford to pay for such a service. The annual per person cost for this program is stunningly low, about $750, and yields a correspondingly impressive return on investment. This
30 seconds, Don.
So maybe if I only have 30 seconds, I'll just move ahead to say that MCOA has been asking the legislature for additional funding for the Meals on Wheels program each year because of the increasing demand. 2 years ago, 1.5 million was approved. This year, we're looking for double that. And we just end with, this is what we know. The 1.5 million appropriated to reduce a wait list 2 years ago ends June 30th. And there was a wait list growing before the pandemic. Thousands more older people now qualify and are receiving Meals on Wheels. And even with the CARES Act funding, which must be spent by September 30th, some AAAs have started wait lists again. So we urge you to take action and please support this legislation. Thank you.
Thank you, Mr. Harden. Questions for Mr. Harden? Seeing none, we thank you for your testimony. Up next is Dr. Sedlak. Dr. Sedlak, welcome.
Thank you very much. Senator Claxton, Representative Mayer, and members of the committee, thank you for including me today and for hearing this bill. My name is Jeff Sedlak, and I am from Falmouth. I am the medical director for Maine for Harvard Pilgrim Healthcare, and have come today to speak strongly in favor of LD 485 to give older adults in Maine access and availability to the Meals on Wheels program. I recognize that real budget constraints make it difficult to fund every worthy program aimed at protecting Mainers, However, both the return on investment to healthcare costs and our responsibility to protect hungry and vulnerable seniors is worth prioritizing this program. I am a general surgeon. I served in Belfast for 6 years. For full disclosure, I also serve on the advisory council of the Southern Maine Area Agency for Aging. It is well known that underlying social determinants such as food insecurity, social isolation, transportation or housing insecurity are significant drivers of healthcare costs. I've spent the last several years with my practice in Alaska screening patients for food insecurity. In our practice, we found that as in Maine, about 20% of our patients were food insecure, 5% significantly so. Doc, I haven't eaten in 2 days and I don't know where my next meal coming from. That's tough to hear. And we needed to have a plan in place for what to do with a yes when we were screening. Maine is a very cool state that has a remarkable number of programs, such as Let's Go 5210, that are really thought leaders on social determinants. A great example, Southern Maine Area Agency for Aging and Maine Medical Center partnered a few years ago to study the Delivered Meals program on people being discharged from the hospital. Among other findings, this Meals on Wheels program was responsible for a 16% reduction in hospital readmissions. The Meals on Wheels program is a necessary adjunct to care for rural Mainers who face challenges with access to groceries or even to safety net functions such as food pantries. Meals on Wheels is a very successful program in Maine. It is also critically needed. In the past year, the number of Mainers served has nearly doubled, nearly 1 million meals to over 10,000 Mainers. Recognizing that success is a key reason behind my support for LD 485. Meals on Wheels is an integral part of the safety net for Mainers. And as we continue to improve asking our patients, our members, our families the tough questions, the Meals on Wheels program is a critical part of the what do I do with a yes? And that is why I am here today. A year ago, Harvard Pilgrim funded a pilot study for Southern Maine Area Agency for Aging and the Maine Heart Center to work together to keep Mainers with congestive heart failure out of the hospital and leading healthy and productive lives. We reached out to identified folks and screened them. We found that 40% of these Mainers qualified for Meals on Wheels and nobody knew it.
30 seconds, Dr. Sedlak.
Yes. And I propose that it's critical and that we need to fund the increased needs for Meals on Wheels as providers and families increasingly ask tough questions and need a response to a yes. Thank you very much.
Thank you, Doctor. Questions for Dr. Sedlak? Seeing none. Thank you for your testimony. Up next is Joy Saucier. Welcome.
Welcome and good afternoon and happy St. Patty's Day to Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Joy Barossi-Saucier. I'm from Presque Isle, Maine, and I offer testimony in support of LD 45 in my role as Executive Director of the Aroostook Agency on Aging and as President of the Maine Association of Agencies on Aging. As we age, we want to make our own decisions and live independently. And we know that when we age in our home communities, we contribute our knowledge and talent to make our community stronger. There are 5 agencies on aging in Maine, and we're all focused on helping older adults continue to live independently in their home communities. As you may know, older adults in Maine number over 369,000, or 28% of the population. And we know that 1 out of every 4 older adults live alone in Maine, and that 1 out of every 6 are threatened by hunger. All agencies on aging offer 5 categories of core service, one of those being supporting the nutritional needs of older adults. And all agencies on aging do this through a variety of programs, including home delivered meals, congregate dining, and nutrition counseling and education. Home delivered meals, or more commonly known as Meals on Wheels, provides the fresh daily meals that's been discussed here. I won't go into detail on that, but I will just remind folks that all participants receive an assessment of their nutrition status, and referrals are made as appropriate to other programs and service, not only to help ensure good nutrition, but also continued independence. Meals are delivered regularly by volunteers who not only take the time to conduct safety checks, as we've heard, but also to provide that caring connection to the community. A Brown University study in 2015 found that older adults living alone who received meals had significant reductions in feeling of isolation and loneliness, were less worried about staying in their homes, felt safer, and experienced fewer falls and hospitalizations. There have been many examples, as you've heard today, throughout the state of situations where meal staff and volunteers have saved the lives of those served. Through the pandemic, as you've heard, we've had significant increase in demand for the service. We've talked about the doubling of service and the fact that we've been, most recent year, have served nearly 1 million meals, 985,000 meals, and 2/3 of those currently on the program continue in normal eligibility, with normal eligibility requirements. I have attached an infographic to my testimony that provides more specifics on the numbers. So I hope that you'll take an opportunity to look at that. Contributions from the community make the program highly cost efficient, as you've heard. Last year, nearly 840 volunteers throughout Maine contributed about 45,600 hours of service to the program. Valued at 1.16 million, this volunteer time exceeded the total amount contributed to the program either through state funding or regular Older Americans Act Title III funding. In addition, the Agencies on Aging raised over 2.5 million to support the program from corporate, individual, foundation, and municipal donations.
30 seconds, Joy.
Thank you. We understand that LD 1001, which was the last package, will end on June 30th. That's at about $750,000 a year. And we understand the federal packages will end as of the end of September. This leaves many older adults in the state at risk for losing this program. This fall, all agencies will be looking at what our volumes can be. LD 485 is one step we can take to prevent this from happening. We appreciate your support as we all work together to continue to meet the needs of older adults living independently in the great state of Maine. I'm happy to take questions. Thank you.
Questions from the committee? Seeing none, thank you, Ms. Saucier.
Thank you.
Up next is Gerard Quayle, and I apologize in advance here for mispronouncing your name.
That's okay. That's okay. Thank you, Senator Claxton and House Chair Meyer and the members of the Joint Standing Committee on Health and Human Services for this opportunity today to bring attention to the importance of home delivered meals, or as Joyce said, Meals on Wheels. My name is Gerard Quayle. I'm the president and CEO of Spectrum Generations, the Central Maine Area Agency on Aging, and I am a resident of Brunswick. Joy gave you the big picture of the whole entire state. So I'm just going to kind of bring it down to one agency to kind of show you how, but we're all pretty much affected the same way. Prior to the pandemic, Spectrum Generations, and this would be in 2019, served approximately 1,229 Meals on Wheels consumers each year, with an average wait list of over 300 individuals. During the pandemic, which is 2020 and counting, Spectrum Generation served 2,289 Meals on Wheels consumers, and that's an increase of over 1,000 Central Mainers. At any given point in normal times, as in 2019, Spectrum Generations and our subcontractors would serve approximately 875 Meals on Wheels consumers per day. During the pandemic, this peaked to as many as 1,800 Meals on Wheels per day. Currently, we're serving 1,494 consumers per day. Of that, 1,100 individuals qualify for Meals on Wheels under the federal qualification guidelines. 394 individuals do not. They're social distancing, and they would naturally be removed from our rolls once the pandemic ends. As Joy alluded to, it is estimated that post-pandemic, the federal funds for Meals on Wheels will return to pre-pandemic levels. If LD 485 is not enacted and the critical state funding for this program expires, which it will on June 30th, Spectrum Generations would have to reduce its Meals on Wheels daily delivery down to 810 persons per day. That would mean instantaneously overnight, the wait list would bloom to 290 people. One of the issues around Meals on Wheels is that people didn't call us before the pandemic because there was a stigma to getting this help. However, the pandemic, the good news out of the pandemic was that that stigma has been removed. People know about this program and are calling, and they want the program now. Every barrier presented by the pandemic or presented by doubling output was addressed and overcome by all the area agencies on aging. Every older Mainer who Yep, every Alder Maine who called. The only thing that will limit us in the future is the amount of funding we receive. And again, this cliff happens on October 1st. Spectrum Generations alone serves about raises about $500,000 to this effort each year. So again, the consequence of reaching this date without additional funding is an immediate wait list. Consumers currently on the program will be discharged. New people calling for assistance will be put on the wait list. So I urge you to vote in favor of LD 485, and I will answer any questions.
Thank you very much. Questions for Mr. Quealy? Seeing none, thank you for your testimony. And finally, we have Patricia Thorson. Ms. Thorson.
Good afternoon, Senator Claxton, Representative Meyer, and members of the committee. My name is Patricia Thorson. I am the Ombudsman Program Manager. The Ombudsman Program is a statewide nonprofit organization that provides advocacy for older adults and adults with disabilities receiving long-term services and supports throughout the state. We serve residents in nursing homes, assisted housing, adult day programs, and recipients of home care services. Additionally, we serve patients in hospitals experiencing barriers in accessing long-term care when they are ready for discharge. We're pleased to provide testimony in support of this legislation. The funding is important to address the growing need for this critical program that serves homebound individuals. We know from our experience in providing advocacy to older and adults with disabilities who receive home care services how essential home delivered meals are in supporting these individuals and remaining independent in their community. For some individuals, this may be the only meal they have available each day. For those who do not have home care staff to prepare their meals, home delivered meals are essential to their well-being. Haley Thomas, a Brown University public health researcher, found that home delivered meals provide health and psychological benefits to seniors beyond basic nutrition, particularly for those who live alone. She found that home delivered meals could help seniors stay in their homes, saving the state money. She also conducted a study for AARP and found that for seniors living alone and receiving the meals, they had reduced feelings of isolation. Additionally, they experienced fewer falls and hospitalizations. Maine ranks #1 out of all the New England states in terms of food insecurity. 15.5% of Maine's older adults are food insecure. For these reasons, as well as in consideration of the state's expanding older population, the additional funds proposed in this legislation will be beneficial for addressing food access barriers for homebound seniors, as well as planning for the future demand for this excellent program. Thank you for your consideration.
Thank you for being here today. Questions for Ms. Thorson? Seeing none. We have no additional signups since we started, so that concludes the public hearing on this bill. Do we have any requests for additional information for Ms. Broom for the work session? Yes, Senator Claxton.
I'd like to understand the federal leveraging dollars and what might be available. That may be in Director Saucier's testimony, but I haven't had a chance to read through all of the notes we have.
And Senator Moore.
Yeah, just one little question, I guess, for the work session would be, I know that most of our area aging organizations ask for a $5 donation per meal, but I know that that's a struggle for a lot of our seniors. And I would just be curious as to how much do they actually get donated for the meals that are received from the actual recipients themselves.
Thank you. That appears to be it. I'm going to pass this over to you now, Senator Claxton, since I am introducing the next bill.
Very good. So that would be LD 578.
That is correct.
They resolve. So the floor is yours, Representative Meyer.
Thank you very much, sir. Good afternoon, esteemed colleagues on HHS. I am Representative Michelle Meyer, serving House District 2 in Southern Maine, and I am pleased to introduce LD 578, Resolve regarding legislative review of portions of Chapter 113, regulations governing the licensing and functioning of assisted housing programs, infection prevention and control, a major substantive rule of the Department of Health and Human Services, Division of Licensing and Certification. That is a mouthful. I am very happy to turn this over to the department's Heather Hyatt, who will provide testimony and explain to the committee exactly what this resolve entails. Thank you very much.
I'm sure she would also entertain questions, but is trying to shirk that responsibility.
Yes, she is.
We'll defer to somebody who knows.
Hello, Senator Claxton, Representative Meyer,
Welcome.
and the members of the Joint Standing Committee on Health and Human Services. My name is Heather Hyatt, and I am an Assistant Director at the Division of Licensing and Certification within the Maine Department of Health and Human Services. I appreciate the opportunity to support and orient you to LD 578 regarding legislative review of portions of Chapter 113, regulations governing the licensing and functioning of assisted housing programs, infection prevention and control, a major substantive rule of the Department of Health and Human Services, Division of Licensing and Certification. This new rule proposes to institute measures to improve and clarify infection surveillance, control, mitigation, and crisis staffing planning in Maine's assisted housing facilities, which include assisted living, residential care facilities, and private non-medical institutions, or PNMIs. The assisted housing programs have increased responsibilities to provide care for the elderly, infirm, and disabled since the development of this care model in 1994. Current rules for these settings support aging in place, which has led to an increased level of acuity for residents of assisted housing facilities. The COVID-19 pandemic has highlighted the urgent need to add provisions related to infection prevention and control that will apply to all types of assisted housing programs subject to licensure under Title 22, Section 7801. These provisions are consistent with state and federal Centers for Disease Control guidance in response to the increased spread of the 2019 novel coronavirus and will help to mitigate any future outbreaks of novel contagious diseases. The new rule adds requirements for infection prevention and control, planning, and prevention measures necessary to increase facility preparedness and reduce the impact of an outbreak should one occur within a facility. The department adopted similar provisions for nursing homes. This rulemaking addresses the likelihood of potential similar outbreaks of COVID-19 or other novel contagious illnesses in Maine's assisted housing facilities, including assisted living, residential care, and private non-medical institutions, and the mortal impact of transmission. In compliance with Title 22, Section 7853, the department developed this rule in consultation with the Long-Term Care Ombudsman Program. On June 25th, 2020, the department submitted draft rules to Brenda Gallant, Executive Director of the Long-Term Care Ombudsman Program, for her review and input. This rule requires that facilities establish, implement, and maintain an infection prevention and control plan, or IPCP, to control the transmission of infectious diseases amongst residents, staff, visitors, and other individuals providing services under a contractual arrangement, and that the facilities employ or contract with a person with certification or training in infection prevention and control to oversee the development and implementation of the IPCP. Thank you for your time and attention. For the reasons I discussed, I'm here to support this bill, and I would be happy to answer any questions you may have and make myself available for questions at the work session.
Yes, Representative Craven.
Thank you, Mr. Chair. So would this continue all the time, whether we had an outbreak or not? Is this something that also facilities are going to get reimbursed for?
The requirement would continue with or without an outbreak or any type of public health emergency. It's really an establishment of an assessment process and planning process to mitigate spread of infectious diseases within a facility, not specific to COVID-19, but including all infectious disease.
Are there other questions? Do we have a sense of how many different facilities or entities this would apply to that would have to contract for services?
We currently have 950 licensed facilities with another 130 pending or in process.
And Do we know what our infectious disease expertise capacity is in the state right now?
Certainly to have an infection preventionist would not be the goal of this rule. It would be really for the facilities to employ or contract with someone with training or education in infection control. And there are training resources available online.
So you could train up to that if you started with a good medical base?
In terms of achieving the infection preventionist credential?
Yes.
I don't, the aim of this rule is not to require that eventually. It's really for a base level knowledge in infection prevention and control so that an assessment can be performed and some plans put in place. These facilities are varied in their settings and the sizes and types of people that they support. So the assessments and the plans would be really tailored to each facility and their needs.
And I was just trying to get at the capacity we have in the state for people who are currently capable of doing that kind of work spread over 1,000 facilities. And I don't want to mandate something we can't deliver on. That's my concern.
I understand. So the department administered through the Office of Aging and Disability Services a consultant program that was free of charge to facilities where nurses trained in infection control were available to assist with the assessment and actually to help facilities develop these infection control and prevention plans. So far, 896 individual sites have availed themselves of this consultation service.
Great. Okay, that was the piece I was missing. Thank you.
Sure.
Senator Moore.
That was the question I was going to ask Senator Claxton. I wondered, because I knew that they were working on it, during this whole pandemic, and I wondered how many of the facilities had already completed the majority of it. So great, thank you.
Are there any other questions that we'd like to ask Ms. Hyatt? I don't see any. Thank you for being here. And I think we're going to hear from Ms. Thorson next.
Good afternoon again, committee members. We are pleased to provide testimony in support of these regulations for assisted housing programs because they are essential in response to the COVID-19 pandemic and the significant risk of virus to older adults and adults with disabilities living in congregate settings. Maine was ahead of other states implementing emergency rules focused on infection control for nursing facilities. We supported those regulations as a needed step to provide greater protection to residents. The regulations mirror those implemented in nursing facilities, and the Ombudsman program did have opportunity to review the draft rules to provide input. Early in the pandemic, we worked with the Department of Health and Human Services, Office of Aging and Disability Services, the Division of Licensing and Certification, and the Maine CDC to carry out infection control surveys in all long-term care facilities across the state. This was helpful in determining infection control practices and providing education to assist facilities to carry out best practices in infection control. Additionally, the Office of Aging and Disability Services engaged infection control consultants to support facilities with infection control and prevention practices. We feel these regulations are critical in guiding assisted housing programs through the pandemic and in protecting residents from COVID-19. Thank you for your consideration.
Thank you. It's great to be hearing stories about cooperation in and out of the department. So we know a lot of that goes on, we just don't hear about it. So this seems like a win. Okay, no questions. Thank you very much for being here, Ms. Thorson. Our last person to testify is Ms. Thibodeau. Welcome.
Hi, can you hear me?
Yes.
Okay. So hello, Senator Claxton, Representative Meyer, and the members of the Joint Committee on Health and Human Services. I'm testifying neither for or against, just because I actually didn't know what to click on this. While I'm supportive of these regulations, I had just a couple of points that I think are important to point out. So like Heather Hyatt said, there are over 900, soon to be well over 1,000 assisted living programs, and they range, from very small 1 to 2 bed homes for group homes for people with intellectual disabilities to rather large assisted living programs for the elderly. And there's a couple of the components in the regulations that are concerning to me. One is the requirement for all new hired employees to have transmissions-based precaution training. And transmissions-based precautions is a pretty extensive training for very infectious diseases. And while I think it's appropriate to require that training, I think it's more appropriate to require it during an outbreak, as you know, very small homes will be training these people initially upon hire, and then the chances that they would actually have to implement this level of precaution, you know, outside of a global pandemic is minimal. And that there's another section, it's A5D, that refers to the requirement to maintain a copy of your infection prevention curriculum that you train your staff on. It doesn't indicate how long you need to retain that, that curriculum. And then the final is semantics of wording, but it is under A4, and it says, facilities must implement any recommendations of the Maine CDC. And I feel like the words must implement recommendations is in conflict with each other. And my question is whether this refers to guidance issued by Maine CDC, and is there, and you know, historically as licensed facilities in other settings, other levels of care, there's been room for interpretation and application to a certain setting and situation, and it appears that that is no longer available. And then, sorry for the noise in the background. And then finally, I just would be remiss, we as oh, I didn't even say who I was at the beginning, I'm sorry. I'm Catherine Thibodeau, and I'm the executive of Independence Advocates of Maine, and we are a disability service provider supporting people with intellectual and developmental disabilities in Penobscot County. And so
30 seconds, Mr. Rowe.
So, yeah, just the unfunded mandate of this, very appreciative of the assistance to get these programs up and running, but there is no funding for the ongoing increased training required of staff on hire, implementation of the respiratory protection plan, and the contractual and staff hours to oversee the program in the long term. Thank you very much for the opportunity to provide comment.
Thank you, Ms. Thibodeau. Does anybody have any questions for her? I don't see any, so thank you for being here. We've heard other concerns about how to log in as either for, against, or neither for nor against. That hasn't been reliable, so there's an opportunity there. Thank you for being here. I don't see anybody else up.
Senator Claxton will be right back. Sorry about that. I apologize, Senator Claxton. You're back with the committee now.
Oh, was I kicked out? I missed everybody. So next we were going to collect feedback from the committee to see if there's any questions for our analyst for the work session. Any info? Yes, Representative Perry.
And I think the question I have, and I wish I'd thought to ask it earlier, is the expectation that they have somebody on staff who does that, or are they looking at a program like we have had in my practice, where there's once a year we have to go through a sort of a training or an online training that makes sure that everyone in the staff has an understanding of infection control and what their job is. So that, I guess I wish I'd asked earlier.
And I didn't see submitted testimony. Maybe I did, from Ms. Thibodeau, which would be helpful in capturing her concerns. So
It's online.
It's on there. It's there.
oh. I'll take your word for it, but I'm not seeing it. We can review that then at the work session. All right. Any other questions? I don't see any, or anybody else to testify. So now we can progress to LD 684. LD 684, which I understand is to be presented by Senator Timberlake. Oh, Mr. Timberlake. Senator Timberlake.
Yes, something.
Something in there.
If I could figure out how to turn the camera on, guys, we'd be in one wicked good position now. Look at that.
Look at that. Welcome, Senator.
Well, good afternoon, Senator, and thank you. You know, I'm not just another pretty face here. Huh?
You're competing with a baby that testified earlier.
There's nothing about this face that competes with that. And I'm looking for my testimony. Here it is. This is where I get myself in trouble, Senator Claxton.
One of the places.
What does that mean? That kind of, you know, that hurt. All right. Good afternoon, everyone. Senator Claxton, representing mayors and distinguished members of the Joint Standing Committee on Health and Human Services. I am Jeff Timberlake. I represent Senate District 22, which includes the towns of Durham, Greene, Leeds, Lisbon, Litchfield, Sabattis, Turner, Wales, and Wayne. It is my pleasure to be here to present LD 684, a resolve to amend main care reimbursement provisions governing supplemental payments to nursing home facilities with high main care use. Long-term care facilities consistently lose money while serving main care residents. The facility often attempts to recoup by shifting costs to private pay residents. However, if a nursing home is almost exclusively serving main care patients, there is nowhere to shift the cost. Back in 2018, the legislature enacted several reforms to the way nursing homes are paid. One of the positive changes provided for a small rate increase for facilities that had an especially high percentage of main care residents. The passage of LD 925 in 2018 addressed these issues and helped facilities survive those whose population is over 80% main care. According to information distributed at the time, the benefit to the facility ranges between $6 to $18 per day, which could mean an additional 5% on the rate of a struggling facility. Although LD 925 accomplished the goals of providing targeted support for facilities with the greatest need, there is one small flaw in the language that can prevent an otherwise eligible nursing home from qualifying for funding. If a facility with a high percentage of main care residents also has high costs, it would be excluded from the added benefit, with the most common reason of a facility to have high costs being the price of labor today. This bill is critical in addressing these inequities, especially now during what some would consider the most trying times in recent history. Coupled with an aging population, we should be doing all we can do to support those who care for our elderly. I appreciate your attention and assure you there are others who will follow me that can answer any detailed questions you may have. Thank you for your time and consideration. And I'll try my best to answer anything I can, but I have for years, a soft spot in my heart is nursing homes and healthcare facilities. And I've just watched them around my area, visited them, friends and family, and just know that we all need to do something from both sides. And Senator Claxton, that's my testimony, and thank you all.
Thank you, Senator Timberlake. Are there any questions of the senator? I don't see any, so we can let Mr. Erb join us again. Welcome back.
Thank you. Good afternoon, Senator Claxton, Representative Meyer, members of the committee. My name is Rick Erb. I'm President and CEO of the Maine Healthcare Association. We represent nursing homes and assisted living, and I'm pleased to testify in support of LD 684 today and thank Senator Timberlake for sponsoring it. One of the most effective steps Maine has taken to preserve access to nursing home care occurred when a bill passed to provide a modest rate bump for facilities that have an exceptionally high level of Maine care residents. Because nursing homes lose money on every Maine care resident they serve, it's easy to see why those with a large percentage of those residents are the most financially challenged. One of the recommendations of the Legislative Study Committee, which Representative Craven and others served on, was to provide financial support to high Maine care nursing homes. This was initiated with a rate bonus to those with at least 70% Maine care population and was expanded to provide an additional amount for those that are 80% or more. This targeted relief has worked well, and I am aware of small rural facilities that have said that the additional funding is what kept them in business. But there is one slight problem we have encountered occasionally. For reasons that are unclear, language is included in the bill that required nursing facilities to have aggregate costs per day that are less than the median aggregate for the facility's peer group. I'm aware of at least one facility that would have otherwise qualified for this relief, but did not because of this requirement. There could be any number of reasons that a facility's costs are above average, but the most common one would be their staffing expenses. The facility that I know of that lost their eligibility for this had a high nursing cost in their area. If they are located in an area that has worker shortages, this is likely to be the case. To my way of thinking, a facility that is over 80% Maine care but has above average costs deserves to receive help with their rate. As I said, no one seems to know why this requirement is there. Fortunately, this can easily be remedied by removing the requirement from statute before another facility is caught up by it. I think this is a common sense solution, and I hope you agree. I'm happy to answer any questions you have.
Thank you, Mr. Erb. Are there any questions about this bill or the challenge? Okay, I don't see any. So thanks again to Senator Timberlake and to Mr. Erb for bringing this forward.
Thank you.
So that'll conclude the public hearing portion of LD 684. Now we'll go to any questions for the analyst before we move on. Any questions about this bill 684 before we move on? Don't see any. So let's go to a discussion of LD 727 and hear from the presenter.
Senator Claxton.
Yes.
Sorry, we're just waiting for Representative Talbot Ross to join us. She should be here momentarily.
Why don't we take a 4-minute break and come back at 2:20? See you then.
Senator Claxton? It's me. I had some conversations with Representative Talbot Ross yesterday about this bill, and I know that there was. So I wondered if she had talked to Carrie about it.
I believe. So at this point, we're ready to get started again. I see enough people to do that. Thanks everybody for getting back here as promptly as you did. So now we'll move to consideration of LD 727, and Representative Rachel Talbot Ross is here to do the presentation. So thank you for being here.
Thank you all, and thank you, Representative Craven, for helping with some communication yesterday. I am pleased to be here this afternoon. I know you've had already a long morning, but I will add happy St. Patrick's Day to each of you, and hope that you have a good rest of your day as we move forward. I also, before I start, just want to thank the Honorable Linda Sanborn, who served with us last session, for helping to bring this bill forward. So Senator Claxton and Representative Mayer and distinguished members of the Health and Human Services Committee, my name is Rachel Talbot Ross, and I proudly represent House District 40, which is located on the peninsula of Portland. It's part of Portland. It comprises the neighborhoods of Parkside, Bayside, East Bayside, Oakdale, and the University of Southern Maine campus. I want to thank you for the opportunity to present LD 727, a resolve to ensure the health and wellness of older residents of the state. I want to start by making sure that you all were given a copy of both my testimony, but also the amendment that I have submitted to this bill. Make sure that you are following along that. I did submit an amendment to the bill, as I referenced, that the Honorable Linda Sanborn had submitted last year that came before this committee. So I am proposing to amend 727, LD 727, in three very, very distinctive ways. Number one, I am removing the requirement that the Maine DHHS request a waiver in order to modify its SNAP or the Food Supplement Program asset policy, removing that requirement. States have the option to make changes like the one I am proposing without seeking permission from the federal government to do so. Number two, I am amending the bill to remove the SNAP asset test for all remaining families still subject to an asset test, and we can discuss my reasons for doing so shortly. And three, I am removing from the bill section 2, which I had included at the request of the city of Portland, but the city has decided to no longer pursue that. So section 2 is the pilot program. That is being removed completely. No pilot. I have also, so as you know, I've attached these proposed changes to my testimony. And based on the amendment, I would respectfully ask the title of the bill to also be amended. And I would suggest renaming the bill Resolve to ensure the health and wellness of residents of the state. So as we all know, SNAP is a tremendously important part of our federal safety net, providing needed nutrition assistance to more than 90,000 Mainers with low income. Historically, programs like SNAP have placed a limit on the amount of resources or assets a family could have and still qualify for help. But today, states are increasingly eliminating the asset test in their SNAP programs, recognizing the importance of allowing families to have a buffer against sudden or unexpected loss of income or unforeseen expenses. We all know these families. We all know particularly what this pandemic has done to those unforeseen expenses. So without savings or temporary setbacks like a job loss, a car breakdown, or needed home repair can begin a downward spiral that sets families back for months and sometimes even years. Today, nearly 2/3 of all states in our country, 2/3 of all the states in our country, including all of the other New England states, so Maine is an outlier, do not use an asset test to determine eligibility for any household in their SNAP programs. Again, Maine is an outlier in New England. We have learned important policy lessons from these states. We've learned that eliminating asset tests increases the number of low-income households with a bank account by 5%, and that the number of families with a bank account with at least $500 in it goes to 8%. For these families, having a bank account helps them conduct basic financial transactions, save for emergencies, build a credit history, and access fair and affordable credit. We've learned that most families applying for safety net programs have minimal assets. Thus, eliminating the asset test has little effect on the program caseload. And we've learned that eliminating asset tests reduces caseworker time and lowers administrative costs by relieving the burden of implementing some of the most complex and error-prone regulatory provisions in the program. States that have eliminated asset limits have found that the resulting administrative cost savings significantly outweigh any increase in the number of families gaining benefits. As you know, SNAP benefits are paid for entirely by the federal government. SNAP administrative costs are shared equally by the state and the local government. So half by the state and federal government. So half of any administrative savings resulting from this proposed change would occur at the state level. It is important to also consider this issue in the larger context of racial asset disparity. While the majority of families receiving SNAP in the state of Maine are white, SNAP is also an important support to families of color, given the persistently low income and assets in these communities. Eliminating the SNAP asset test can help us take an important step towards addressing the striking disparity in assets across racial and ethnic groups, which is important for promoting a more robust and inclusive economy for all of us. To summarize, eliminating the SNAP asset test would be beneficial to both program participants and the state. Instead of forcing families to deplete their savings to qualify for help, and I know you know many families like this, they deplete their savings just to qualify for the help, thus leaving them in an even more precarious state. This policy would promote savings, giving families greater security and the opportunity to save for their future. It would reduce administrative burden and take a step forward addressing racial and income inequality. I really thank you again for the opportunity to present this legislation this afternoon. I'm glad to answer any questions, and there will be a number of other folks testifying that can do a deeper dive into the specifics of the program that are coming after me. So thank you very much for listening so intently.
Thank you, Representative, for introducing this bill. Are there any questions for Representative Talbot Ross? I don't see any, so thank you. And we'll proceed to hear from Amy and Dan again. As soon as you're unmuted.
Hello.
Hello.
Good afternoon. My name is Amy Regan-Gallant. I'm the Vice President of Public Policy and Research for Good Shepherd Food Bank. This is Diana. She is a resident of South Portland, Maine. And we are here to support this wonderful bill and the amendment. You have my testimony. Leader Talbot Ross and I did not write it together, but they are so similar. So I'm not going to read it to you. You just heard a lot of the information. I will say two things. The first is that I have worked on this asset limit elimination issue for a long, long time. I'm so happy to talk about it in depth in the work session here with any one of you who might have questions. I also always want to make sure that people understand that eliminating the asset test does not eliminate the income eligibility test. Those are two very different things. So right now we have Mainers who are income eligible for SNAP, but because they have some savings, because they have 2 cars, et cetera, they're not asset eligible for SNAP. So the income eligibility would stay. And second, I want to tell you about what happened when I was writing this testimony. My mother-in-law, I'm very fortunate, comes to watch my girls on Mondays and Tuesdays, and I was working on this testimony. And she said, "What are you working on?" And I said, "Oh," and I explained it to her, and she said, "Is that the program that you tried to sign my mom up for?" And I said, "Yes." Her parents, a couple years ago, I felt were probably eligible for SNAP. So we went through the process, and they were indeed eligible for the minimum of $16 a month, 1/6. And the reason was largely because of their assets. And no, that's not true. I'm sorry. They were not eligible at all. And we tried to fight it, and it just didn't work for them because of their assets. And today, my mother-in-law's mother is on a prescription drug that costs about $1,000 a month. And those two issues are related, because if she had spent down her assets a couple years ago in order to get eligibility for SNAP, she wouldn't have the money that she needs right now to pay out of pocket for this prescription drug. So it's a complex financial situation that a lot of Mainers are trying to put the puzzle pieces together for. If this committee uses the power that you do have to eliminate that asset test, it would just, as Leader Talbot Ross said, it's a win-win for SNAP recipients, for those who are income eligible and yet not eligible because of their assets, and for the state government. Happy to take any questions. As I said, I'm really excited that this is in front of you again. And want to thank you for your persistence in working on it session after session.
Thank you for your testimony and for bringing the baby back. Representative Madigan.
Thank you, Mr. Chair. Thanks for being here, Amy and Diana. Love seeing Diana here. When you told the story of your mother-in-law,
yeah,
having having to spend $1,000 a month on medication. I mean, that's a similar story I've heard from constituents, that they may have a retirement account that gives them some small income that allows them to pay their property taxes or things like that, but they have high medication costs, and the asset test gets in the way of them qualifying for other things. I'm wondering kind of if you could kind of expand or, tell us a little bit more about what are the things that folks may have to spend a lot of money on that just the asset test does not capture.
Sure. So currently in Maine, the asset test is $5,000, which means that if you make under the income eligibility, so for a family of one, God bless you, Diana, it's $23,000. So if you're income eligible, you're pretty poor. And then you have $6,000 in assets. So you have some savings, and if you're a homeowner, that savings is going to go for an emergency home repair, a roof, a furnace, a plumbing issue. I was on the phone yesterday with a food security advocate and a member of Congress staffer, both of whom had unexpected plumbing issues that they had to, we had to hurry up the call and go. We all have those issues that we have to have savings for. And when we don't, we end up moving out of our homes that we could otherwise afford and getting back in the rental market, which is typically more expensive, or on a very long affordable housing wait list, which the last time I checked was 6 years to a decade long. More than one vehicle is also considered an asset that could disqualify someone from SNAP. So having a family with 2 kids, 2 vehicles in Maine are pretty important. We don't need them right now because I'm working from home. However, if a family in Maine has 2 vehicles and are income eligible for SNAP, that second vehicle could disqualify them. So if you think about kind of the basic emergency fund that any of us are advised to save up for, those could be some of the things that would deem a family otherwise ineligible.
Thank you. And I just want to add one final comment that it seems like the way it is currently, unfortunately harms people that do the responsible thing, right? You know, they put aside some money to allow them to have a little money in retirement, or, you know, for that, you know, they know the roof's going to need to be replaced in the next 5 years, or whatever that is. So thank you very much.
Wouldn't
You're
you
welcome. And
agree?
Wouldn't you agree?
Yes, I
Would
would. good
Diana agree as
representative.
well? That's really the crucial question here.
Yeah, I think that really hits the nail on the head. It really continues this behavior of spending, which is contrary to what we all strive for in these temporary assistance programs. SNAP is meant to be a supplement. TANF is meant to be temporary. WIC is by nature temporary. We want to construct financial ladders for people to have short-term support so that they can get back on their feet. Look at New Ventures Maine. They have wonderful savings programs that match, in some cases, one-to-one, dollar-to-dollar, to help people achieve their saving goals. And once they save, in some cases, as we're saying, could be ineligible for the SNAP that they're required to put food on their table. So it's really contrary to that ideology of saving and of these being temporary supports.
Thank you for that, Ms. Glant. Are there any other questions? All right, we'll move now to Ms. Silvius. If you want to unmute and join us, we'd be glad to hear from you.
I'm glad to be here. Good morning, Senator Claxton, Representative Meyer, and members of the Committee on Health and Human Services. My name is Carolyn Silvius, and I live in Portland. I'm a member of Homeless Voices for Justice and a longtime advocate for the poor, homeless, and hungry in Maine. I'm here to speak in favor of LD 727, which would eliminate the asset test required to receive SNAP benefits. The income threshold required to qualify for SNAP is very low. It is doubtful that anyone who meets this requirement will be able to save enough of their income to move them out of the poverty level. Therefore, the asset test is simply another impediment to receiving benefits and not necessary. A few years ago, I lost my SNAP benefits for a short period. At that point, I had been frantically trying to save every penny I could toward the price of an inexpensive used car, which because of my disabilities, I desperately needed. Without my food stamps, in order to buy food to stay alive, I had to use my savings. Everything I had managed to save in the previous year was gone in 2 months, and so was any hope of the car I needed. Having a modest savings account is a reasonable practice. A few $1,000s in reserve for unexpected or unplanned emergencies such as transportation, healthcare, or even housing costs is just good practice. A person should not have to completely impoverish himself in order to buy the food necessary to live. It makes no sense. I urge you to preserve access to SNAP, a means of survival for Mainers. Restrictions such as asset tests and qualifying for unrelated programs should not be allowed to stop Maine citizens from accessing food benefits. Food is life, and I want to live. Thank you. Any
Thank
questions?
you for your testimony. Are there questions of Ms. Silvius? I don't see any. Thank you again. Now we'll move to Izzy Ostrowski.
Good afternoon, Senator Claxton, Representative Meyer, and esteemed members of the Committee on Health and Human Services. My name is Izzy Ostrowski, and I'm the social change advocate at Preble Street, a human services anti-poverty agency with over a dozen programs and services provided across the state. I'm here today to testify in support of LD 727. Over the past year, there has been a dramatic rise of food insecurity in Maine, a problem that was already extreme before the COVID-19 pandemic. Preble Street served 1 million meals in 2020, a massive increase from the yearly average of 625,000 meals served in years prior. A report titled The State of Poverty in Maine 2021 stated that 1 in 8 adults, including 1 in 5 children, experience food insecurity yearly. This crisis is dire, and it threatens every community across Maine, with Black, Indigenous, and people of color experiencing higher rates of food insecurity and hunger. This bill would provide crucial steps for mitigating Maine's hunger epidemic by increasing access to SNAP for some of our most vulnerable populations. Removing the asset test for older Mainers and people with disabilities is a common sense policy that can reduce hunger. When Maine reinstated these asset tests in 2015, it caused more than 8,000 people to lose SNAP. The asset test punishes Mainers who have modest savings for other essential costs associated with housing and well-being by causing them to lose SNAP, although they still experience hunger. For example, a 70-year-old man from Oxford County lost his SNAP benefits because he owns 2 old and unreliable cars. He's lucky if he can get one car running and on the road. He alternates between the 2 cars and tries to scrounge up enough money to fix one, but before he knows it, something else needs fixing. Because he owns these 2 cars, he lost access to SNAP. This man used his SNAP benefits to buy things he can't get at the food pantry, like fresh vegetables and meat. Now he's forced to rely on the pantry for his food needs. Preble Street provides emergency food to people who vary in age, life experiences, and assets. Veterans throughout the state receive food through our Veterans Housing Services program. Emergency food boxes are prepared and distributed by case managers and other agencies, and people line up outside of Preble Street's food pantry to receive food boxes. So I ask you, what is the underlying connection here? All of these people are food insecure and they all need better access to SNAP. Therefore, the language of this bill should be amended to eliminate the asset test for all. When Mainers have access to nutritious food, our communities thrive and grow. When our neighbors struggle with hunger, the impact on our state is dire and far-reaching. Preble Street urges you to vote in support of this bill as an act to support addressing the state's hunger crisis. Thank you.
Thank you for your testimony. Are there any questions? I don't see any, so thank you again for being here. And that'll take us to Christine Hasted, if you want to unmute and join us.
Thank you very much, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Chris Hasted. I'm the Senior Policy Advisor at Maine Equal Justice, and I'm speaking today in support of LD 727 as amended, with my gratitude to Representative Talbot Ross for introducing the bill.
Were we supposed to be seeing you, or is that to me?
I let you see me. Oh, I guess. How's that?
There, that's much better.
Well, thank you very much. I don't know if it's much better, but it's nice to see you all.
It's definitely better.
Okay, so I'll try not to repeat many of the points that have been made by people who came before me, and thank them for their testimony as well. And I also want to mention before I start that AARP, Lori Parham from AARP, did submit written testimony and asked me this morning if I would tell you folks that she supported the amended version of the bill, and that's how what she wants her testimony to reflect. So I can't speak for AARP, although she asked me to, and I'm a member, so I'm passing on my words of support for them. I think you've heard a lot about the SNAP program, and I think you all know a lot about the SNAP program. It's the strongest anti-hunger program in the country. There are about 165,000 Mainers who received benefits from that program last month. That's about 1 in 8 Mainers. The program last month generated $35 million in revenue for the 1,400 participating retailers in the state. And I think you've heard also about the very unfortunate position that Maine is in relative to very low food security. We are second, I'm correcting my own submitted testimony earlier, we're second lowest in the nation, or excuse me, highest in the nation in very low food security. We're on par with Louisiana and Mississippi in that unfortunate distinction. And what that means is that what very low food security means is that families have reduced food intake and disrupted eating patterns because they have a limited amount of money to buy food. I'll just give a very quick history of this issue in Maine. The federal government gave this option to states in the late 1990s. Shortly after that, the state legislature passed a law eliminating the SNAP asset test for families with children. That was what the federal law authorized as an option at that time, and Maine did that right away. We codified it in statute. Sometime later, in around 2010, the federal law had changed so that states were allowed to eliminate the asset test for any SNAP family. And Maine took that option by regulation in 2010. And as Amy mentioned, in 2016, that was changed so that the people protected by regulation lost that protection. And the only people that remained protected, that is, had no asset test, were families with kids. And so that's just a brief history. We are basically returning to where we were before in 2015, if this bill were to go into effect. And I think you heard from Representative Talbot Ross that is the position, or that is the policy that is in effect in 35 other states in the country. 2/3 of all states have eliminated the asset test for all SNAP participants. And that's because of all the testimony you heard here today. It both improves the quality of life for those folks, gives them an opportunity to save, and reduces the burdensome administrative effort that's involved in implementing these very complex asset rules. I also would want to remind you of a report that you received from a working group last year. And that was a working group that came from a bill that was submitted by your own Representative Madigan, asking the working group and the department to look at asset tests in various public benefit programs, including SNAP. And
that's Christine.
Thank you. And that group did so. And to make a very quick summary, they recommended the repeal of the asset test in the SNAP program and others, saying that they believed it would increase access to food and reduce food insecurity. So thank you very much for the opportunity to speak with you today, and I'd be glad to answer any questions.
Thank you for that testimony. Are there any questions, Ms. Hasted? I don't see any, so thank you again for being here. I think that completes the people that I'm aware of who wanted to testify on LD 727. And so are there any questions for our analysts for a work session? I'm not seeing any. Representative Perry.
She mentioned a report that came to us last session. If we could be pointed out to that report, I would appreciate it.
Okay. Anything else? So that'll conclude the public hearing portion of consideration of LD 727. And that makes us ready to move.
Thank you.
Thank you for being here.
Hi, Rachel.
Nice to see y'all. Bye.
So that brings us to LD 614. And Representative Toole is not yet available that I see.
He's coming though, I think.
I've reached out to him and his aide,
Okay.
and so I hope they will be joining us shortly.
Okay.
And I
So-
did too. I told him we were ready for him.
4 minutes? You want to take another break for 4 minutes? Okay, let's take a break for 10 and we'll come back at 3 o'clock.
Sounds good.
So for those of you who are joining us again, we're waiting for one of our legislative colleagues to come to a presentation. He's busy with another commitment, so we're not sure we'll be able to get him here, but somebody will present his testimony one way or the other. We'll give him a little bit longer.
He did just send me a message and said he's going to jump on real quick. So hopefully
Okay.
he'll be here momentarily. There he is. Yay.
Welcome, Representative Toole. When you're all set, have a chance to catch your breath and want to
Yes.
click
Thank
on
you.
your video.
Okay, let's try that. Let's try that. Let me try to get the screen. There we go. I'm sorry, Senator Claxton.
It is totally understandable, Representative Toole.
In many ways, this is harder than doing it running from one room to the other. So, but thank you, Senator Claxton, Representative Meyer, distinguished members of the Health and Human Services Committee. My name is Will Toole. I represent the communities of Cutler, East Machias, Eastport, Lubec, Machias, Machiasport, Roque Bluff, Whiting, and Truscott Township. It is my honor to join you today to present LD 614, a resolve to extend funding to the Maine's Veterans Home during the COVID-19 pandemic. LD 614 is a one-time extension of bipartisan legislation sponsored by Senator Lucchini that this committee unanimously passed 2 years ago, which required HHS to amend its rules governing Maine care reimbursement in order to provide cost-based reimbursement to Maine veterans homes, nursing facilities. The bipartisan work needed to get then LD 606 funded in the last biennial budget is both a testament to the impact and commitment to award-winning care each of Maine's veterans homes from Scarborough to Caribou are committed to providing, those who gave the best years of their lives to serving our country. As a grandson and nephew of veterans who fought in World War II, Korea, and Vietnam, caring for those men, women, and their families ought to be the highest priority. Maine Veterans Homes is doing so every day without fanfare and doing so on a shoestring budget. They are meeting and exceeding their statutorily required mission with honor and dignity and not asking for much in return. While Maine Veterans Homes certainly supportive of this bill and will be testifying in favor of it today, they did not ask for it and were, upon hearing that I had submitted it, blown away that a legislator not known for supporting extensions to one-time funding put the bill in. During my time in the legislature, I have made great friends at Maine Veterans Homes in Machias. The staff, residents, and community that supports our Machias facility is amazing. In many ways, they are like family to me. Myself and Senator Moore have attended birthday parties, celebrations of life, and other ceremonies there, and make it a point to do so every chance we can. Representatives Perry and Alley have as well. I have no doubt that the other co-signers of this bill have the same level of commitment to the MVH facilities in their communities or similar relationships. These are not just facilities. They are part of the fabric of the community. I'm sure by now you are getting the drift that we love and admire Maine Veterans Homes and all that they do. But I'm also sure, even with that, that you are asking yourself why we are coming back for quote unquote one more time after we had agreed on the original bill. 2 years ago, when we pushed for the original legislation, nobody knew a pandemic was knocking at the door. Nobody knew that Maine Veterans Homes would be personally, deeply, and irrevocably affected by the ravages of COVID-19. Many lives were lost. Staff, residents, and their families' lives were changed in ways nobody saw coming. MVH responded to those challenges and continues to do so even today as we slowly recover from the virus that has conservatively killed upwards of 500,000 people. We believe this funding is essential to helping MVH respond to and recover from the COVID-19 pandemic. We also believe that losing $2 million a year would result in staff cuts and facility closures in rural areas where the cost of providing quality care is higher and is higher. And we believe that preserving this funding for 2 more years will give Maine Veterans Homes the time it needs to develop other funding sources and get on a stronger footing while carefully and compassionately responding to the needs of the community. I would gladly invite your questions. However, I would also like to encourage you to discuss this in greater depth with Maine Veterans Home staff who have signed up to testify today. Their stories of navigating the pandemic, doing so on a tight budget, and all the while repeatedly fulfilling their obligation to the legislature are sobering and inspiring. It is with that I wholeheartedly and enthusiastically recommend a unanimous ought to pass decision during the work session and look forward to taking the case to the full body and ultimately appropriations if it is successful there. And for Senator Claxton, Route 9 was a bit touch and go Sunday when I rode down. That's an old state and local joke. Thank you all.
My day is complete, Representative Toole. I'm glad we waited for you. It was worth it for that alone. Yeah, state and local. So are there any questions for Representative Toole? I don't see any. I do see that Senator Farron is here. So let's recognize Senator Farron. Do you want to unmute yourself and join us, sir?
Absolutely. Absolutely. Thank you. Bouncing between VLA and here, so been waiting along.
I know the gig.
Good afternoon, Senator Claxton, Representative Meyer, members of the Health and Human Services Committee. I'm Senator Brad Farron. I have the honor of representing the people of Senate District 3. I'm pleased to be before you today. Gotta shut down my volume on this one. Apologies. To testify in support of LD 614. It's a resolve to extend the funding to Maine Veterans Home during the COVID-19 pandemic. The Maine Veteran Homes, MVH, was established by the Maine legislature in 1977 and operates as an independent nonprofit receiving some funding from MaineCare and Medicare, just like nursing homes. The mission of MVH is to provide short and long-term care and support for veterans and eligible family members. As has been discussed the past several years, nursing homes are struggling financially due to a combination of low reimbursement rates and an increase in the minimum wage. Not unlike Maine nursing homes, MVH has faced this same struggle. To help address the reimbursement shortfalls, the legislature included in the budget a one-time appropriation in the last biennium of $1.5 million as a supplemental payment to MVH. MaineCare then submitted a plan to the Center of Medicare and Medicaid Services to obtain matching fundings, and was successful in receiving approximately $2.6 million in qualifying federal dollars. During this period, the pandemic hit and severely affected MVH operations and fiscal health. Here we are a year into the pandemic. Families, businesses, nursing homes, and MVH continue to struggle. As a result of the pandemic, MVH is seeing a $1 million operating loss per month. MVH saves the state of Maine roughly $3 million a year in keeping veterans off of MaineCare. However, due to the reimbursement shortfalls, they are being faced with significant operating losses, particularly in their more remotely located facilities. Through this resolve, the Department of Health and Human Services will extend the previously approved supplemental funding for MaineCare to MVH facilities through June of 2023. By that point, we hope the pandemic and financial losses associated with it will hopefully be behind us, and the new reimbursement rate will help to provide relief to the operating losses MVH is currently experiencing. I look forward to working with this committee on this bill through challenging budget times. I know we've got some great co-sponsors and folks to speak forward on this, and we'd be happy to answer any questions. But I think the experts are in the queue, as they say.
Thank you for that, Senator Farren. Are there any questions for Senator Farren? I don't see any. Back to
Thank you,
VLO.
folks.
Thank you.
Thank you very much.
We're also joined by Kelly Cash. Welcome, sir.
Thank you. Senator Claxton, Representative Meyer, and the distinguished committee members. I am Kelly Cash, CEO of the Maine Veterans Homes. And thank you for the opportunity to testify for LD 614. As Representative Toole noted, the proposed bill will extend the Maine Care supplemental payment that was provided by the prior legislature in the current biennial budget. Unlike all other state veterans homes across the nation, which are funded all or in great part by the respective states, MVH operates as an independent nonprofit organization. MVH operates 6 facilities, employs over 1,000 staff, and has an annual operating budget of approximately $100 million. The reason for last session's legislation that led to the current supplement was that MVH is reimbursed by MaineCare based on the average cost of its assigned peer group. However, MVH has no peers by comparison. First, we must comply with numerous additional and more stringent VA requirements, which other providers do not have. Second, our residents vary greatly from those at other facilities. Their medical needs tend to be more complex, require more staff and resources, especially for veterans with post-traumatic stress disorder and other service-connected injuries. For these reasons, MVH costs are higher than its peers. MVH averages $3.3 million in annual shortfall from MaineCare. That is the difference between what MaineCare defines as allowed costs and what we are actually. This deficit is unsustainable and threatens the financial viability of the entire system. The legislature agreed and appropriated the time-limited supplemental payment. We are most grateful for the department's work to submit the required state plan amendment with justification, which was approved by CMS for the federal match. We hope to find a permanent solution with the ongoing review of MaineCare's rate structure. However, it will be at least a couple of years before nursing home reimbursement is addressed. It is important to note as well that MVH saves the state millions of dollars annually by keeping veterans off MaineCare. In addition, MVH has saved the state tens of millions of dollars by providing 100% of the required state match for federal construction grants, which all other states provide for their state homes. More information is contained in the attachments of my written testimony. In closing, we support LD 614 as an interim measure until the pandemic is over and changes can be made to the MaineCare rate structure. Thank you for your consideration, and I'm happy to answer any questions.
Thank you, Mr. Cash. Other questions? It sounds to me, sir, that one of the problems is the challenge of finding an adequate or an appropriate comparison group. It really can't be the nursing facilities for the civilian population with the additional challenges. So have you done work cross borders to sort out how you compare in terms of provision of services and cost with other state homes?
Yeah, and actually, a lot of states recognize that and say, okay, our state veterans homes are going to be more costly for a variety of reasons. Vermont is one case where they have waived the upper payment limits for their state veterans home. I'm looking up some other exceptions. We did work with MaineCare and CMS experts to research examples and precedents from other states for their state homes. And again, Vermont was one of those. I also want to note that there are precedents in the Maine principles of reimbursement where certain nursing facilities or specialties receive cost-based reimbursement because of their unique circumstances or related additional costs. And these include the remote island nursing homes, community-based specialty nursing services, publicly owned nursing facilities, and ventilator care services.
Yeah, if there was a summary sheet or 4 or 5 examples from other states about how they handled financing and funds, that might be helpful for the work session.
Yes, sir. Okay.
Thank you. I know you have nothing else to do, but it helps us make an informed decision.
No worries. Thank you very much.
Are there any other questions of Mr. Cash? I don't see any. I don't see anybody in the waiting room who wants to testify. Oh, except for Senator Moore wants to testify.
Thank you, Senator Claxton. I just wanted to say just a few words in support here. You all know me. Good afternoon, Senator Claxton and Representative Mayor Meyer, distinguished members of the Joint Standing Committee. As you know, I represent Senate District 6. I am here today to testify in favor of LD 614. The bill is about veterans, their spouses, and Gold Star parents, making sure they continue to have and receive the highest quality nursing care in the state. Right now, as has been reported before me, Maine Care reimburses Maine veterans' homes less than 90% of the allowable costs of care for eligible veterans and their family members. In normal times, this results in a shortfall of approximately $3 million annually. As mentioned by Representative Toole, LD 606 from the 129th did help close the gap by leveraging the $2 million in federal Medicaid dollars. Then COVID-19 hit. The veterans' homes continue to struggle as they work extremely hard to keep their residents safe and healthy. And with all of the additional requirements, they're losing about $1 million per month. I think Senator Farron mentioned that. Kelly Cash did a great job of describing why this bill is so critical. But I will tell you just another reason why I support it. As Representative Toole mentioned, in Machias, the Maine Veterans Home operates a 30-bed residential care facility serving residents with early stage dementia who need a secure environment. In addition to providing award-winning care, the facility also provides the food and laundry services for Downey's Community Hospital in Machias. With all the pressure our rural hospitals are under, arrangements like these are critical for their long-term success. I urge the committee to pass LD 614. This bill is so important in ensuring continued access and care for deserving veterans, spouses, and Gold Star parents. Thank you. And I would be happy to answer any questions if you have any.
Thank you, Senator Moore, for that testimony. Are there any questions of our senator? I don't see. Representative Zager.
Thank you, Mr. Chair. It's actually not a question for Senator Moore, but to thank Colonel Cash for coming, and also just to confirm I understand this correctly. So in attachment 1 that you provided, which I appreciate, you compare Maine to all the other states in New England. It seems like you're doing an awful lot on, as Representative Toole said, on a shoestring budget. No state match for construction, and also the operating is also no state supplement. That's incredible. And can you give any insight into how you're doing that? How you're able to do so much with so little?
Well, I certainly can't take all the credit for it. My predecessors certainly set us up in a good stead. I can tell you that our founder, Bill Carney, actually worked the Medicaid program for the state, helped found the state veterans homes, and thought they should operate as a nonprofit. Separate to that, we have been able to build capital reserve when we're funded adequately, reimbursed adequately. We've been able to build a capital reserve to pay for a lot of our projects. The nice thing about being able to use our capital reserves and not have to go to the state is that we can be much more responsive and timely in our projects and less costly, because we don't have to wait for the several years to go through the state legislature to get that state match funding. So that certainly has helped us in that regard as well. If we're reimbursed adequately through the other programs, Medicare, Medicaid, and other payers, we are able to operate. But you got to have a margin to be able to reinvest and to invest in your people as well as your training and your programs and do the things for your residents. While other states fund their programs entirely, completely, I think we've been very competitive in keeping not only low cost, but high quality, very high quality. We're able to run like a business more so than maybe some of our colleagues are. And again, that's not meant to point fingers or condemnation, but it really makes us much more responsive and nimble, and we're able to do that.
I appreciate that. Thank you so much.
So any other questions? Yes, Representative Connor.
Thank you, Mr. Chair. And thank you, Mr. Cash. I just really quick on the chart, do any of the veterans that are staying there, any of them receive federal dollars in any of their, either through comp and pen and whatnot, that also goes towards their stay in the home? And if so, should that be on this chart as well or not? If I'm way off base, please just let me know.
No, that's an excellent question. So as a state veterans home, we're able to access programs for our veterans. One of them is a daily stipend for our veterans to help offset the cost of their care. So for example, if somebody's on Medicare and they're a veteran, obviously in a state veteran home, they will receive a daily stipend of approximately $120 per day, which will help offset their copay for Medicare. And they're able to retain those dollars and not spend down their wealth and have to eventually convert to Medicaid. Our veterans who are 70% or more disabled, the VA pays for their care directly, and those folks don't go on main care rolls as well. And then again, we can access as a state veterans homes, we can access the state home construction grant program as well. And that pays, the match is 65% of allowed costs for a project. And for example, our Augusta building the new campus that we're putting together right now that will open later this summer, that project's about a $91 million project. We got a $49 million VA grant to build that, and Maine Veterans Homes is providing the other $41 million, part of that through our capital reserve and part of that through our borrowing capability. We do have the ability to borrow up to $50 million.
Excellent. Thank you. That's all I have, Mr. Chair.
Okay. And as I understand it, this would provide 3.6 million a year for the next 2 years. Is that approximately? Is that right?
I believe so, yeah. Well, 1.2, 1.3 would be state, and
Yes.
the other balance would be a federal match.
Okay, very good. Okay, thank you for that. Any questions? Thank you for being here. Thank you, Senator Farron, for your testimony. And I guess Representative Toole has departed for his other commitments. So I think, as I understand it, that'll conclude our testimonies on LD 614. And are there any questions for our analysts in anticipation of the work session? I'm not seeing any, so we're all set. So I look to Anna to see if there's any business we need to conduct now before we consider adjourning. Representative Connor. Oh, I just see your yellow box is lit up.
Sorry.
Okay. So I saw a head shake from Ms. Brum as not having other stuff to do. Gary, are we all set? Okay. So I would entertain a motion to adjourn until 10 o'clock tomorrow morning, at which point we will resume. There's a motion and a wave second. All those in favor of adjourning?